And welcome to the Deschutes County Board of Commissioners meeting for 9 a.m. Wednesday, March 3rd, 2021. First item on the agenda is Pledge of Allegiance. Please join me.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next on the agenda is citizen input for items not on the agenda. So I know we have a public hearing at item number 8, and there was some requests to be a part of that. So if you're here for public hearing on the ambulance service area, that will be coming later. Are there any, so if somebody's in the Zoom meeting, they could raise their hand to request to speak on a citizen input on something not on the agenda. No hands raised, okay. Are there any phone numbers that we don't recognize or any phones? Okay. So we do have a hybrid of a meeting now. We are on Zoom, and we do have opportunity for somebody to come in person. So in the future, if somebody has citizen input, they could join us. At this time, consent agenda.
So move the consent agenda.
Great.
Second.
Okay, any other discussion?
I just want to thank James Lewis for volunteering to serve on CYC, that board.
That's what I was going to say, okay. With that, Commissioner Adair?
Yes?
Commissioner Chang?
Yes.
And Chair votes yes. At this time, action items, number 7, presentation, Lapine Sun River Habitat for Humanity. Dick Arnold, Wade Watson, and Dwayne Crumey. Thanks so much for joining us in person.
Good morning. My name is Wade Watson. I'm a member of the Board of Directors of Habitat for Humanity of Lapine Sun River. And with me today are Dick Arnold on this side. He's also a member of the board, and then Dwayne Crumey is our Executive Director.
Okay.
So the demand, despite COVID, the demand for housing, affordable housing in Deschutes County continues to be high. We have found that our demand specifically is high because basically we are able to get people into a home with a mortgage payment that is less than the rent that they're presently paying in South Deschutes County. That's the mortgage payment, the taxes, insurance, as well as the homeowners association dues. So obviously it's a pretty easy decision for people to make to apply for one of our homes. Prior to 2014, our organization was building one house per year, and then we gradually started to have an increase in demand, and we built our organization to be able to respond to that. Since 2016, we've consistently built 3 homes per year. 2 of you at least will recall that in 2018, the county donated 1.85 acres of land to us, and we're very grateful for that. It's allowed us to continue to provide the homes as economically as possible. We then got the subdivision approval from the city of Lapine and built the infrastructure in 2019, and then continued to build homes. There are 19 two-story townhomes in the subdivision. Each one of the homes has 1,350 to 1,400 square feet, 3 bedrooms, and a single-stall garage. So this is a picture of the plat. Basically, we started in 2019 by building that one triplex on the right-hand side of the screen. Last year, we built another triplex, and the permits are ready for us to pick up for the ones that will start in April, assuming that we don't have another deluge of snow.
We might.
So we're very proud of what we're building. We think that they are very attractive additions to the Lapine community. So the COVID-19, when we needed to start making decisions last March on how we were going to proceed or if we were going to proceed, The challenges, as you'll recall, looked pretty daunting, but we decided that we really didn't have an option other than to proceed. So the first decision was to do our volunteer work with smaller crews than we usually have, just in order for us to maintain some social distancing. That, of course, related to then needing to work more days. We doubled the number of days that we worked all of last summer. We scheduled everything such that the volunteers and the subcontractors were not working on the same day. Again, just trying to keep the population on the site down. We hired some subcontract work that we would have normally done with volunteers. We just didn't feel comfortable that we could maintain the social distancing with volunteers doing that work. And then we had a number of delivery delays, not unusual, but electrical panels and breakers and appliances. We ended up having to buy some of those units also. But despite all of that, despite all the challenges, we prevailed and were able to move people into their homes first part of November after starting in April. So we're pleased with that, and that gave us confidence to know that we could do it again this year. Our 2020 mortgages totaled $170,000 per unit. You can see on here the townhouse cost, $135,000. The lot development cost, that's over and above the free land that you donated to us. And then we have an overhead fee that it doesn't cover our overhead, but it is a fee that we do charge. So we were at 170. The appraised values came in between 212 and 220. So I'm sure you're aware that that basically allows people to be capable of getting an 80% traditional mortgage, because basically the difference there is the equity. But our biggest challenge over the course of the last 4 years or so has just been trying to keep the costs contained so that we can continue to reach as low a level as possible. Despite all of that, many of the families that we get applications from are just not able to qualify for various financial reasons. And that's very disappointing to us, but we continue to strive to try to keep the cost as low as possible. This chart is a little bit busy, but I wanted to demonstrate to you that we have had a consistently increasing cost in terms of what we're doing. And take a little bit of time here just to talk about it. A couple of things. 2018 was the last detached single-family home that we built. 2019 is when we started the townhouses. So there's a significant difference in the lot cost. We were previously, the cost on our books for the lots that we had previously were $40,000 a piece. If we were going to replicate those now, it would probably be in the range of $50,000 a piece. So the $30,000 development cost for the smaller townhome lots, and with your generous donation, makes a huge difference in the bottom line. Another thing that I want to make sure I point out is that if you look at the construction costs from 2019 to 2020, you might think that, construction costs didn't really rise. Several of you know that I'm a retired engineer, and I'm going to tell you, as a retired engineer, you never get it right the first time. So when we were building the townhouses in 2019, we recognized a number of things that could be done better, and so we revised the design. From the outside, you won't really be able to tell, but a number of things with respect to the structure were changed. Otherwise, the 2020 cost probably would have been more like 140, maybe even a little higher. Another thing to point out here is that in our projected costs, based on the supply estimates that we've gotten and the subcontractor estimates that we've gotten, our estimate for 2021 is 185. As you recall, on the last slide, 170 was basically the threshold for a mortgage that people would be able to afford. So we still have that dilemma that we're trying to solve. Where the extra $15,000 is going to come from? But I guess it's just a demonstration of increasing construction costs. I should have mentioned, you're probably aware that the biggest component of that is lumber. Lumber prices this year have just gone skyrocketed. So that's a huge impact for us. So we are the only organization in South Deschutes County that is providing homes for that component of the population that earns 80% or less of the area median income. We're proud of the fact that we're able to do that. One of the things that surprised me when I first started to become involved in Habitat 6 years ago is I didn't realize that many of these people had never had the vision of owning their own home, either because previous generations of their family had not owned a home, or it just seemed out of reach. So one of the most satisfying things for us, obviously, is when we get to the end and these very excited people who never envisioned they would be able to own a home are able to get the keys, as is shown on that picture. Mm-hmm. We've built 24 new homes in the city of La Pine in the last 10 years, so made a pretty significant difference in the tax base. So we remain very committed to building to whatever extent the demand is out there. The demand has been a little bit suppressed as a result of COVID. People losing jobs or being really apprehensive about their economic status. But if the demand increases post-COVID, we're very committed to doing whatever is necessary to meet that demand. So we're getting to the point where we're starting to think about what is the future beyond Putney Place. It takes about 2 years to go through the subdivision process on raw land and to get the infrastructure in place. And we are perhaps as little as 3 years away from completing Putney Place. So, it's time for us to start thinking about that. And we really look forward to the cooperation that we've received from the county in the past, and hopefully that can continue into the future. So I'm open to any questions you might have.
Yep, commissioners?
I'm very curious about the choice to go to townhomes. You mentioned that the lot development costs are significantly lower for a townhome versus a single-family home. Is that true also for the construction costs? I mean, in terms of materials and labor and other things. I mean, in your table, it looks like the townhome costs from in 2019 is higher than the single-family home construction cost in 2018. But I'm not sure if that's partly just about these inflationary issues that we're talking about.
I would say that in the private sector, that they would be approximately equivalent, the two-story versus the single-story. For us, there is a slight increase in the cost because a lot of our volunteers are like me. And we really don't want to put them up on a two-story scaffolding. So we hired some things done, for example, the roof trusses and the roof sheathing and that we could do on a single-story home with volunteers. So there is a slight increase, but the majority of the increase in cost that you saw on that chart relates to just increases in inflation of construction costs.
Right. And also, in terms of construction costs, you mentioned the challenges of COVID this year and using more subcontractors and having to spread out workers in time and space. And the lumber, the lumber costs going up this year, which is apparently this escalation in lumber costs. It really is related to COVID and all the people who want to do projects during COVID. When COVID is over, when we don't have to, when it's not shaping our activity nearly as much as it is now, do you expect that some of those COVID-related costs will be kind of they'll go away? I mean, the additional costs of doing construction during a COVID year will go away.
We're hopeful that will be the case. We're going to be able to return to doing things with volunteers that we've historically done with volunteers. That will certainly be part of it. It's just the lumber price thing is just a supply and demand issue. Right. And I wasn't specific, but our price for 2021 is about 30% higher than 2020. And it's just a supply and demand issue that every developer or builder is facing.
Right.
Hopefully, as borders open up, Canadian border issues, and hopefully we don't have the fires that we've had. Hopefully the prices for lumber will return to something a little closer to where they were last year and the year before. Yeah.
That's what it is.
The global market's cyclical. It's lumber is a hard thing to predict.
Commissioner, could I ask a quick question related
Please.
to cost? So the new Lapine Sewer SDCs went into effect last year. Is that get any kind of break for affordable housing on the city?
We actually made a presentation to the city council last week asking for some relief. Because SDCs on our houses represent about 10% of the construction cost, which is a big deal. That's if we were able to get all of that relieved, that would allow us to qualify people that made about $2,000 a year less than what we presently need. So, it's a big deal.
What was the reception from the council?
Well, they obviously wanted to caucus about it, but generally I would characterize it as very favorable. Yeah.
Thanks.
When you said 30% increased costs, were you talking about just lumber or, I see inflation everywhere when I'm out shopping, and I'm just wondering, was it just lumber or is it all building products?
The 30% figure related just to lumber.
Okay. Well,
we've been very fortunate to have subcontractors that we've used for a number of years, and they pass along the increases that they have to, the material costs that they incur. But otherwise, they've been very good about holding pretty close to their costs from year to year.
so do you have 3 families now that are thinking about your units you'll be building this year?
No, there are 3 families that are already approved for
great.
this coming year.
Okay, and I know personally that I love Habitat's program, and please think ahead, think what you're going to need in the future, and the fact that you've done, 24 homes is really outstanding. 24 families have a wonderful place to live, and they're paying less than what they probably would be paying in rent elsewhere. So, I mean, it's really remarkable.
Well, thank you.
Well, and I always celebrate, just that little bit of pride of ownership, participating in the construction process, so you mentioned, not even being able to have the vision of doing the ownership, but seeing how a house comes together, and I've been at the construction site. I helped up tip a wall or two in my day, but, just seeing how do you make a house, and not everybody gets to see that. So thank you very much for just the whole process of what Habitat does. For the city of La Pine, this is that time where there's a lot of housing pressure. People are looking for houses, and the market rate houses are being built and sold as fast as they can also. But then also I think of it as kind of the critical mass. There's going to be some folks starting some companies, so there will be generally some more jobs. So we got to kind of fire on all cylinders to help that little town grow. And then the complement with Sun River. I mean, COVID times have really put us on our heels, but there's opportunities there for the vibrant economy that the Sun River itself creates. So, I mean, it's real positive in the future. It's a shame that those lumber costs are so high right now. I mean, because that's just so tangible. Just buying the raw materials to be able to, hammer together. It's just amazing watching that happen right now. And thank you very much for taking time to present to us. Looking forward is the step. You just laid it right out for us. It takes 2 years to maybe get the land organized, and it's 3 years from now you're going to need it. So this is exactly the optimum time to have this discussion. The county is a landowner there, but there's other things happening too. The city itself and other private landowners. So it's going to be interesting watching that city evolve here in the near future. As I say, I advocate for the economic development efforts for sure, to see if people want to work, where are they going to work? So we got to get that going too. So thank you so much.
Yeah.
Let me reiterate how thankful we are that we've had the cooperation with the county over the course of the last several years. It really does make a difference. The fact that we did not have to purchase that land allowed us to provide housing to people with lower incomes than we otherwise would have been able to do. So thank you.
Yeah. Can I ask? So it sounds like you're already thinking about your next project. What kind of land requirement are you thinking about for that next project?
Well, I would say number one, being as close into the city as possible is really useful. The property that we have is within a half mile of all of the schools. Where we were building previously is still within the city of La Pine, but it's out on the outskirts. We have a number of clients that are single mothers, and so for that kind of family situation, not having the ability for the kids to be able to walk to school or to the store is a huge handicap. So that'd be number one, is as close into the city as possible. Mm-hmm. Number two, I would say somewhere in the range of 2 to 4 acres. The development costs, the subdivision and development costs, the hiring of consultants, the fees, and then the construction of the infrastructure become more economical per lot the larger the development. So this, we were able to get 19 homes on 1.85 acres, and it still ended up at 30,000. If we had been only able to get 10 homes, it probably would have been more like 45. So obviously there's economy in a larger size. So those would be, I guess, the two things that I'd respond.
Good to know. Thank you.
I just have a personal question. Do any of you men golf? Because my husband golfs, but this is like such a wonderful thing for retired people to participate in. And I just, I really admire your effort and the fact that you can get your costs down. I built a couple of homes, and I know when you, the second home I think was way more efficient than the first home. Just, you understand what you're going to get. And it is really critical that you look at all those little details.
So was that offer to help advocate for
Bob help?
Well, a golf tournament fundraiser, or?
Oh, we should do that, shouldn't we?
Yeah.
You guys, do you have fundraisers? You do, don't you?
The resort has been a wonderful partner in terms of doing a golf tournament every year. Of course, 2020, they weren't able to do it, but it's been a terrific fundraiser for us. So, assuming that it comes back in August this year, you'll have to get your husband's.
I'll sign him up. That's what I'll do. Yes, so he can participate in his way, so.
Here we go. Yeah.
Thank you. Oh, that's wonderful.
Yeah, well, and I'd look forward to getting back on that track too, because that's also advertising opportunity, explaining to people what the great work that's being done.
Yeah, yeah. Well, the resort has been a terrific supporter of ours. Their management recognizes the benefit, and we, frankly, have had a number of their employees become homeowners. So it works well for both of us.
Yep, absolutely. Well, thank you very much for taking time to join us today. Great to see everybody, as I say, in person today, so that's a novelty itself. But we're working our way out of COVID, and vaccines are coming, so, yeah. Thank you very much for your effort.
We've all three been vaccinated, and you all deserve compliments for the operation at the fairgrounds. After watching so many negative things on television, to go up there and be in and out in 45 minutes was just, it was amazing.
Wonderful. Great.
Very well organized.
Thank you for the feedback. Yes.
Thank you.
Thank you so
Thank
much.
you.
Thanks for coming.
Have a great day, yes. So I see videos down. I don't know if that's telling us something or not. The Zoom, yeah, okay, it was just blacked out. So at this time, item number 8. This is public hearing and consideration of ordinance regarding the ambulance service area. So Chris Bell can maybe kick us off, and we'll acknowledge this. This is a public hearing on the matter.
Good morning, Commissioners. As you know, I'm Chris Bell, Assistant County Counsel with the Legal Counsel's Office, and this morning we have on the agenda the adoption of amendments and edits to Deschutes County Code, Chapter 8.30, which relates to ambulance services, and in particular ambulance service areas within Deschutes County. Also amendments and edits to Appendix A, which is the ASA plan, which sort of details the ins and outs of the duties of franchisees who have ambulance service areas within the county, and also the duties of the board and the board's ASA Advisory Committee with respect to administering, managing the franchises and the ASA plan itself. With me today, I see right now is Tom Kuhn, who's the with Deschutes County Public Health, but also is the administrator of the ASA Advisory Committee. There were 4 members of the committee who were scheduled to be here today. I see 2 of them. Perhaps the other 2 are online but have not joined the Zoom meeting. That would be Chief Ken Kimna from Redmond Fire and Rescue, Deputy Chief Drew Norris from Bend Fire and Rescue, and I see they're both on at least this Zoom call. I know Captain Jared Ernest from Black Butte Ranch was also planning on being here, as was Captain Jared Jeffcutt from Sun River Fire Department. Mr. Jeffcutt is also, Captain Jeffcutt is also the ASA committee chair. So just some brief history. We have the ASA plan and the ordinance, Chapter 8.30 of the Deschutes County Code. Those have been basically untouched and unmodified, I believe, since they were implemented several decades ago. Since that time, things have happened. In particular, the county's grown, and the committee and I believe the board was approached by Lapine Rural Fire Protection District, if not last year, then the year before, suggesting potential changes to the code and to the plan, in particular wanting more flexibility, more freedom to subcontract for not only non-emergency and intra-facility transports, which were allowed under the plan under under the original plan and code under certain situations and stipulations, but also for emergency transport, which was specifically prohibited by the plan. You could not subcontract that. After being approached by Lapine Fire, and in particular Chief Supkis from Lapine Fire, the board took those suggestions to heart, and also took a look at the code and kind of took a more holistic approach, looking at, I believe, I'm summarizing this correctly, kind of, what could be implemented to not only, maybe assist Lapine Fire with some of the issues they brought to the fore, but that would also be applicable generally to each of the 8 franchisees within the county. So I met with members of the committee and with Tom Kuhn, and they worked very hard and very diligently on putting together some changes that they felt would sort of address some of the issues that were brought up originally by Lapine Rural Fire District, but also that would perhaps benefit generally the other franchises within the county. So you've been presented with the proposed changes. Just a couple quick notes on those. I think that the changes kind of fall into 3 broad categories. The first one just kind of being grammar and readability. As I said, I don't believe there have been too many edits, if any, since the code and the plan were originally implemented. So we took a look at grammar and readability and also organization, and sort of made some changes to address some of the issues we saw with that to help make the code more readable, more user-friendly, and it just kind of takes some of the language issues out that we found. The second major area was to update the language. A lot of the language from the original plan sort of came from the original plan, so it sort of assumed that all the franchises were new, and talked about certain dates from when they were established and when things would change. Those dates have all passed, so we updated that language. We also have updated some of the language, or the committee has attempted to update some of the language to just take into account some of the sort of changes in circumstances, but also to try to refine some of the definitions, try to update some of the definitions, and actually to try to define some terms that were not defined in the plan that are either in the code, that are either used in the plan and the code and had no definition, or have practical application outside of the code in implementing sort of the ideas of the code and the plan out in the field. And so the committee believed by putting some defined terms in there that weren't in there before, it helped clarify the issue just for all the franchises. And finally, there were substantive changes made. The primary substantive changes were made to the code in the area of subcontracting. An entirely new section was drafted and proposed at 8.30.075 to specifically allow for subcontracting of emergency transports, so long as the subcontractee is vetted basically along the same lines as franchisees are vetted. There are good policy reasons for that, and I'm sure the committee can discuss that with you if you have questions about that. So that now franchises can subcontract emergency services, whereas before they could not, and therefore have more flexibility in determining how to allocate their own resources and how to maybe bring in other agencies or even members of the private sector to maybe take some of the load off, or to more efficiently allocate resources, and then also to kind of more readily allow franchises to subcontract non-emergency transports and intra-facility transports, and do that in a quicker, more efficient manner. I would note that there is one additional change that's not noted on the change that or the edits and the changes that you've already received. That was, the reason for that is it was just kind of brought to our attention yesterday, and that there was perhaps some problems in one of the definitions that might create some conflicts elsewhere in the code and the plan. And that is the proposed change is to a defined term. It's number 9 in the ASA plan, which is Clausen priority dispatch. And I'll just read the definition right now for you, and then I'll sort of suggest what the proposed change is. So Clausen priority dispatch is a defined term. It's a system used by the PSAP, which is essentially the 911 call center, to prioritize calls from least severe to most severe. Then there is a second clause, or actually 2 sentences at the end of that. Omega, Alpha, and Bravo calls are usually considered non-emergency calls, period. Charlie, Delta, and Echo calls are always considered emergency calls, period. The proposed change to number 9 is to take out the term Clausen, and really that's just because apparently Clausen is the physician or doctor who came up with the system in the first place, but it's not really used in day-to-day terminology or vernacular, either at the PSAP at 911 or by the providers who interact with 911. And the second proposed change is to scratch or delete the second 2 sentences so that the definition would read, priority dispatch is a system used by the PSAP, PSAP, to prioritize calls from least severe to most severe, period, and that would be it. So that's just an additional sort of, I think, probably pretty minor change that wasn't noted originally, but that was brought to the committee's attention yesterday, and the committee all agreed that would be a good change just to be more consistent and not conflict with other areas within the code or the plan. So again, the committee worked long and hard on these changes. They wanted to make sure that the changes benefited all the franchises, but also address some of the specific concerns of Lapine Fire. And I guess at this point, we would open up to questions for the committee. They're a lot more qualified than me as a lawyer to speak on emergency services and ambulance transports and issues of that type. And so I would turn it over to them and to you for questions. And I would invite each member of the committee that's present to unmute their computers and answer any questions for the board. Obviously, I'll answer some if you have some legal or wording issues that you'd like to address with me, but
Great, thank you very
proceed.
much. So this is a public hearing on the matter. We do have committee members of our appointed ambulance service area. I do acknowledge that the public hearing is open on this matter, and having our ASA participants, our appointed members, kind of provide the lay of the land. So 'cause my point is there'll be switching gears to other testimony is what we would do is kind of step 2. So yeah, Tom Kuhn and other ASA members. So yeah, this is a Zoom public testimony period, so let's step through there. So can you get Tom Kuhn up, or I don't know how yeah, just on the display is maybe unmuting and then he'll pop up. Okay, there we go. So one question, Tom, we did make a change in the ASA from a 5-year franchise to a 10-year franchise. So it was mentioned that basically the franchise, the ASA agreement, the document itself, hasn't changed substantively since the beginning. So we'll just acknowledge that there have been changes over the years, and that was just one of the items I remember, recently. That
and also in 2013, we made some changes and some language edits as well. So there have been changes. This, I would say, at this time, we went through it more thoroughly with the assistance of county legal and decided to do a really good cleanup job while we had it open for edits.
So it isn't just picking off one item, it was really kind of laying it out as a whole.
Yes, yeah, we went through every detail. Chris Bell really helped us out a lot to fine tune the language, and we thought at this time, let's just revamp the plan in addition to making the edits that were requested of us.
Great. Okay, so then, other statements as the ASA committee chairperson or the administrator? Yeah.
Yeah, I think Chris covered it pretty well. Basically, there's language cleanup, grammatical type things, but also allowing a ASA franchise to subcontract with a private entity to do emergency transports. That was the most substantive change, and also adding a few definitions in there that weren't in there for some clarity. And our ASA committee members use their best judgment with their experience and knowledge working in the EMS sector to come up with the best language that they thought was fair for everyone.
Great, thank you. So then other ASA committee members for input, testimony? Ken Kemna.
Anyone else want to speak up from the ASA committee?
Okay, well.
I can say a couple things.
Okay.
We've spent quite a bit of time.
Introduction for the
working on
record,
the document.
please. Just introduction.
Jared Jeffcott, chair of the committee, captain and EMS coordinator for Sun River Fire.
Thank you very much.
Now, this committee has worked on this document for quite some time now. We've put a lot of effort and energy into it. I know myself, I've researched ASA plans all over the state of Oregon, from Lane County to Multnomah County, Washington County, and even some of the rural counties in Oregon. And I think we've put together a really good document that addresses a lot of questions that are recurring questions the franchisees ask about the document. That we should have one of the better ASA plans in the state at this point after adopted.
There we go. Okay. Thank you very much for that input.
Mm-hmm.
So anybody else from the ASA Advisory Committee? So seeing none at this time, other public testimony. I do see Chief Mike Supkis is part of this hearing at this time. There you go. Okay, Chief Supkis.
Good morning, and thank you for all the work on this. The district is excited about the flexibility about adding more resources to handle emergency and non-emergency calls, especially in the interfacility arena. And if Mr. Bell agrees, the way we read it, we're going to be able to do that with this. However, in reading the whole document and going to the appendix, I do have a question. There were some new definitions added to this, and we have not participated with the SA committee since August on this. We did provide some input, and we appreciate that what input was accepted. But in the appendix on number 43, there's a new definition of unstable patient. And I just like, we kind of read it, and but if give the committee and the commissioners, if you would, what's the purpose of adding these new definitions to the ASA plan?
Okay, so you're asking a question at that time? Asking a question for that definition?
Yes, sir. And our concerns are it basically locks out option for people that aren't calling 911 in our world, and then also it hands it keeps our providers, your paramedics, your physician advisors, determining what's an emergency call and not an emergency call, and it shifts that to a professional medical facility. As you're aware, the reason we're going through this is the impact of the professional medical facilities using 911 resources for in-facility transports.
Okay. Yeah, okay, so thank you very much. I'm sorry, what was that?
And I said the reason we're concerned about this is we're desperately trying to meet that need. And I just wanted to know the reason why that was added in there. What purpose does the board see having that there?
Okay, thank you very much. So, yeah, let's take that as a note at this time and look for other testimony on this topic. And then, yeah, there may be a discussion, I guess, at this point. Are there any other requests to speak on this subject? Are there any other hands raised in an attendance status? I'm sorry? Okay. So Joel Whitmer.
Oliver Tatum has his hand raised.
Oh, great, okay. So if Joel Whitmer is available for testimony. Okay.
Okay, I'm here now. This is Joel Whitmer. Are you picking me up okay?
Yes.
Okay. I'm a director with the Lapine Rural Fire Protection District, one of the 5 directors, and have had a chance to go ahead and review the new ambulance service area document. In reviewing it, agree with Chief Subcus. I'd like to bring attention to the commissioner's document, and just in looking at the purpose stated in 8.30.020, the basic purpose of this document reads, the purpose of DCC 8.30 is to establish ambulance service areas, assign emergency ambulance service providers, recognize non-emergency and interfacility ambulance providers, create an ambulance service area advisory committee, provide penalties for violations of its provisions, and prescribe effective dates. So in general, this document is looking over the different ASA areas, the franchisees, and how we as organizations operate. But what I'm seeing within this change, specifically what Chief Subcus addressed in 43 and again in 40, defining stable patient in section 40 and then 43, identifying an unstable patient, is we're now taking and we're moving into the letting the medical profession move into the document relating to the ambulance service areas. And under 43, I think probably my biggest challenge in here, when I read it, it seemed to me that this was directly introduced into the document as coming from a medical provider, medical facility. I'm not sure who submitted the language for this, but that's the way that it looked to me. And I think what's happening is we're starting to get maybe too much input coming from these medical providers that's moving out of the scope of really what this was designed for. And in the last part of number 43, well, let me just read 43 for the record. It says, unstable patient is any patient who cannot be stabilized, who is deteriorating or likely to deteriorate. A medical provider contacting 911 for emergency transport may make the determination whether or not patient is stable or unstable and requires emergency transport. These patients require emergency transport. So it really is, as Chief Subcus had spoken about, it really is just completely putting this into the medical provider's hands and really turning the organizations that are operating under this document, and it's hamstringing them to a certain level, saying, you know what, doctors make every decision and you just better listen to what it is that they're saying. And if they say transport, then you have to transport. So I think we're just running into an area that presses the boundaries a little bit, and I'd like the committee to go ahead in its evaluation at if this is truly required and necessary in keeping that in there.
Thank you very much for the testimony. So at this time, Oliver Tatum.
Hello, Commissioner Adair, Commissioner Chang, Commissioner DeBaum. It's nice to see all of you. Thank you for giving me the opportunity to speak. My name is Oliver Tatum. I'm a paramedic and a registered nurse. I currently serve as the clinical supervisor at St. Charles Family Care and Immediate Care here in Lapine. I just want to offer some additional context to this conversation. In 2020, our clinic had 16,000 patient encounters between family care and immediate care. That's not counting our lab or x-ray departments or visiting specialties like cardiology. In that same year, we referred over 700 patients to the emergency department in Bend for conditions ranging from difficulty breathing and chest pain to altered mental status, possible strokes. Nearly 500 of those patients were admitted to the hospital. We activated 911 fewer than 100 times. By the fire district's own estimate, Lapine Fire transported 95 patients by ambulance from our clinic in 2020 out of a total of 16,000. As you know, Lapine Fire adopted an ordinance to bill medical facilities who activate 911 on behalf of their patients. The fire district decided 25 of our patients met their criteria for emergency transport. Patients who did not meet their criteria included patients with unstable vital signs, heart rate in the 30s, blood pressure in the 70s, dangerously low blood oxygen levels, patients with acute alterations in mental status, patients in extreme pain. Essentially, the fire district's definition of an emergency is only that which requires a hospital activation, a cath lab activation, a stroke team activation, a trauma surgery activation. As a medic myself, I can tell you these are good rules of thumb for when to call a helicopter, but not for a ground ambulance. I believe the revised ambulance service area plan presented today offers much needed clarity on what constitutes a medical emergency and whether a patient is stable or unstable. It will make Lapine safer for the people who choose to live and visit our community. Thank you again.
Great, thank you so much. So a little bit of clarity. So you mentioned 700, 500, and 100. I was writing the numbers down. So 700 emergency department references, 500 admissions, but 100 calls to 911 for transport?
Yeah, that's correct. And those are rough estimates based on what I'm able to pull up out of our electronic health record using our reporting system. So whenever possible, when we believe, when the treating provider, who's a physician, nurse practitioner, or PA, all of our providers have experience working in emergency departments themselves. When they deem that a patient is at risk of deterioration or permanent disability because of what might be an emergency condition, and it's a condition we can't rule out or treat here in the clinic, we send them to the emergency department at the hospital in Bend. If we feel it's safe for them to travel by private vehicle, either because we feel that they can drive themselves safely, or they have a family or friend or some alternate means of transportation to get there, and we think that they can get there, again, safely without deteriorating between point A and point B, we do try to send them a private vehicle. But there were approximately 100 patients that we felt the risk was too high to travel by private vehicle, and we activated 911 on the patient's behalf.
Great, thank you very much for that.
And then, Oliver, after you said those numbers, you said 25 patients met the criteria. Could you repeat that phrase? I just was taking notes, and I just want to make sure I captured your comments correctly.
Sure. So every time we send a patient by ambulance, we receive an invoice from the fire district. We appeal that invoice, and in his denial of our appeals, the chief usually gives us some indication of how many patients they have transported from our clinic to the hospital. And from his letter in January, it appears that they transported 95 patients from the St. Charles facility in Lapine to the hospital, and 25 of those were granted an exception. So they decided, based on their criteria, that they would bill the patient and not bill St. Charles. So taking 25 from 95, we have 70 outstanding invoices.
Thank you for that clarification.
Mm-hmm.
So public hearing on the matter. Are there other people requesting to speak? And yeah, just looking for more input at this time. Is there anybody else on Zoom with a hand raised or requesting to join us? Okay. So, yeah, there's a couple layers to this, and I'll acknowledge that. I've been studying it. This is a legislative matter. I guess I'm looking for clarity from Chris. This is a legislative matter where, information can be shared inside and outside this public hearing. This is kind of the public hearing on the matter officially with this set of changes. As I say, I've had some discussions with different parties on this also. Can you just confirm or clarify that for me, Chris?
Commissioner DeBone, yes, I believe this is clearly a legislative action by the board and that we're changing county code, which is essentially legislation just like the Oregon revised statutes or any other code or system of laws. This is the law of Deschutes County, so you are definitely within your legislative function, in my opinion.
Yep, okay. Well, and I'm saying that so for the other commissioners, if there's questions, if there's people you want to talk to or get feedback from, we can kind of search down a path or two outside this meeting, but also, we'll bring it back to this public session. Any thoughts from the other commissioners at this time? Or?
Is it does it work within the structure of this hearing to ask questions right now?
Absolutely.
Well, one question I'd like to ask, which members of the committee may be able to answer, is how these definitions and how this attempt to clarify what an emergency is and who makes that determination and when, how that affects County 911. Is this? I'm concerned about 911 being, caught in a position where they need to, where they need to make recommendations or where they need to make determinations and dispatch, and whether they're, I guess, kind of whether they're being stuck in the middle right now, and whether these definition clarifications are helpful to smoothing that process out at the dispatch point.
I'll just start off by saying that we did have Chris Perry from Deschutes County 911 involved throughout this entire process of making these edits. So he was comfortable with all the edits and also provided us with some input.
Thank you.
Okay. So we are scheduled for a 10 o'clock COVID update today. I'm leaning towards the concept of closing this oral portion of a public hearing on this matter, or possibly extending it. I guess I'm kind of trying to figure out what we might want to do here.
Can I just ask one question?
Oh, please.
Tom, can you identify who came up with the definition of the unstable patient? It makes sense to me in my experience, but I just wondered if you can say, where did that definition come from?
Yeah, I can at least start off by saying that it was taken from the National Highway Traffic Safety Administration's guidance document that they have. And when we were looking at our edits, we saw some different definitions like in documents like that and also in other ASA plans that were examined that we didn't have within our documents. So we thought to provide better clarity that we would go ahead and add some of those definitions just to make our plan a little more robust. There has seemed to have been some confusion over who makes determinations of whether a patient is stable or unstable. So using the experience of our EMS providers, we decided that the medical provider contacting 911 would be the one assigned to make that determination. And the basis for doing that was just to provide further clarity, which we saw was missing within the plan. And if any of the other ASA committee members want to chime in, feel free to do so.
Commissioner Adair, Jared Ernest, Captain at Black Butte Ranch Fire EMS Coordinator. I provided that National Highway Transportation Safety Guideline to the committee. The reason for doing that is even within our own state OAR 33, that covers a lot of our EMS guidance as far as how we're taught, how programs will be developed at an educational level, also as how we're going to conduct ourselves in the state. That document specifically will state that curriculum that meets or exceeds the National Emergency Service Education Standards, Emergency Medical Responder, and Structural Guidelines published by the National Highway Transportation Safety Administration will be used. That goes for EMRs, EMTs, intermediates, and paramedics. If that document stated in our own OARs, it was my belief that we should use the same organization that's basically giving us our foundational knowledge on what to do in emergency calls, and we use that document's verbiage in our own ASA plan. So that's where I was pulling that information from. Hopefully that clarifies why a little bit better for you.
Yes, thank you so much.
Commissioners, I might add too that just to clarify, the definition of stable patient found in paragraph 40 or new paragraph 40 after the addition of the other definitions, that was in there prior to the changes made by the committee. So that's a current definition and has been for some time. Unstable patient, another reason I recall from our discussions is because there was no definition for unstable patient. And I guess the conclusion could be made that an unstable patient is anything except a stable patient. And I think, again, that sort of highlights the need to define that term and to specify and to clarify it, because I think if the opposite of stable patient is just assumed to be anything besides what's in this definition, that's a pretty broad and pretty vague term or definition or concept. And so I, from my recollection too, there was just a desire to clarify what unstable patient meant from the committee.
Thank you, Chris.
So as I say, this is a public hearing on the matter. I'm interested in a little bit more information because there's a, kind of another path of activity going on here, which we know about. So at this time, I'd propose that we extend the public hearing to a board meeting in the near future. So I don't know that we're going to set a date today, and get a little bit more information. Are the other commissioners comfortable with this?
I think the sooner we do it, the better. I think it's really important for our community. When you look at the last document was 8 years ago in 2013, our population has gone up 25%. And don't forget the tourists. We've gone from like 400,000 at Smith Rock to 1 million. So yes, the sooner we get this established, I think it's better for the safety of all our communities.
Well, and this can come back in 1 or 2 weeks.
Okay, as soon as possible.
I'm okay with that.
Okay.
I would like to ask, one question that arises for me is that I'd like to ask Chief Supkis to give us an alternative if you don't like this unstable patient definition. Basically the process and the decision maker identified for identifying an unstable patient, like what an alternative would be for the process and who makes the determination on whether a patient is unstable or not. Because without an alternative, it's really hard to consider whether this is good language or whether it's not good language.
Well, I could say that there's a scenario here. Somebody is at their private residence and a medical situation is happening. They decide to call to 911. I need help. Ambulance shows up and it's a transport to the emergency room. Or a person decides, hey, I don't feel well. I'm going to go to the doctor to get help. And then the doctor says, well, you need to call 911, or I'm going to call 911 for you. to get you to the emergency room. So it's that scenario that I think it kind of boils down to. I think of that as a software developer is why I say the words scenario. You know, who called, where was the decision space for that patient? Because then it ends up, which we know, the other part of this is the billing. You know, the decision was made either to go to a medical clinic for help or to go to the emergency room by the patient, or there's another step in there. So, yeah, this is the kind of the decision that we can learn a little bit more about and bring it back.
Well, my personal experience being that I'm married to a retired otolaryngologist, and we moved here, and he had chest pains and didn't tell me for a week, and then he said in that voice like I've done something wrong, Patty, you need to drive me to the hospital right now. I'm having chest pains. And I'm going like, don't you want me to call an ambulance? And he goes, he's a doctor. He said, no, you'll get me there faster. But, you know, I know that's not always the right decision for everyone. And then it happened again when we were in Portland. And I am driving through the biggest rainstorm of the decade in Portland and getting him to the hospital. Unfortunately, he was able to have his stents put in, and he's been really healthy ever since. But, you know, you want to be able to call your ambulance when you need it, and really, they are trained, the EMTs, the medics are trained, and I think that's really critical. I don't know why my husband has such faith in my driving ability, I guess.
Okay,
that's all.
So at this time, this is extending this public hearing to 1 or 2 weeks from now during another board meeting of the Board of Commissioners.
Okay.
Thank you. So
hopefully next week, if we can.
Yeah, as I say, we'll look at the agenda now.
I think that would be, it's a timely thing.
Very good. So thank you very much for joining us, and we will bring this matter back. At this time, item number 9, COVID-19 update. This will be from our Health Department.
Good morning.
Good morning. So this is Dr. Conway and Nahad Sadar-Azodi. So this is switching gears. We're going to do a Facebook Live here. This will be our COVID public health update. Looking for confirmation that we have a Facebook Live stream. Was that yes? Okay, thank you. Please proceed.
Okay. Thank you, Commissioners, for inviting us. For the record, my name is Nahad Sadar-Azodi. I'm the Director of Public Health for Deschutes County Health Services. I'm joined by Dr. Conway, Director of Health Services. And I believe also Molly Darling is also on the call. She is currently in a Deputy Incident Commander role as part of the response. Many thanks to Jenny Faith and Morgan Emerson for helping us with the preparations of the slides. Also, as usual, I extend my gratitude to all health services staff. This week in particular, I would like to give a shout out to our behavioral health downtown clinic team. They lost their manager, who's actually on this call, Molly, due to her joining the incident management team during the same period that they were onboarding a new program and 3 relatively or brand new supervisors. And yet they have carried on helping some of our most at-risk clients without missing a beat. So this is a shout out to that team. Our next slide is the number of new cases by week, and some of the numbers have been updated since the slide deck I sent earlier this morning.
We don't have slides up yet at this time.
We need our slides
They're not being presented.
shared. Yes.
No, if you're having a problem, I can share them and advance them.
Oh, share the slides. I thought you were talking about the sort of the printed slides.
There we go.
Yeah, thanks for the reminder. Great. So what we have here, so as I mentioned, the numbers are slightly updated, and since March 11th of last year, we have a total of 5,962 cases reported with, unfortunately, 60 deaths. This past week, we had 105 cases reported. So we are continuing to see a downward trend, which is fantastic, of course. And fairly soon, if we continue with this trend, I would imagine in the next couple of weeks, we actually will go from where we are now in terms of high risk level to moderate, which is really great news. So far this week, we have only reported 10 cases. And this committee members ask me all the time, I mean, what is this a function of, the downward trend? And I guess it's difficult to pinpoint one thing. I would start off by saying that, first of all, it's a function of the choices and behaviors that all of us are engaged in. The weather is improving and people are spending more time outdoors where it's better ventilated, of course. And it's also possible that we're building a bit of herd immunity through natural infection and the vaccination that's going on. So it could be a function of multiple factors. Nevertheless, we are seeing a downward trend, which is really great news for everyone. The age distribution of cases, frankly, remains consistent with previous weeks. We see more than 50% of the cases amongst 20s, 30s, and 40-year-olds. We do see majority of the cases, we do see the 20-year-olds comprising majority of the cases, or the highest number of cases, I should say. And I would, from my perspective, I would imagine that we will see a bit of a shift in patient demographics as older age groups become vaccinated. So we might see this shift a bit in coming weeks or months. This next slide is the number of tests undertaken per week. During the most recent week, from the available data that we have, there were over 5,000 tests conducted with a positivity rate of 2.7, so less than 3%, which is fantastic news. And frankly, again, from my vantage point, unless we do mass testing events and or institute routine testing, if we have better technology for it, what I'm seeing here suggests that we are probably at equilibrium from the last few weeks. It doesn't mean that we shouldn't do more tests. It just means that this is pretty much what can be done given the constraints that we're facing. And maybe even a bit less, because somehow the numbers are a bit, we might see a bit less testing because we're seeing less outbreaks, especially in long-term care facilities, which is fantastic news, right? We're seeing less outbreaks in our long-term care facilities. So this is where we are in terms of our testing capacity and demand.
Nahad,
next
sorry, Nahad, I read in the news somewhere that there was a national trend of declining testing. So we're last week when the number of tests was lower than it has been, I was a little concerned that we were part of that national trend. But I mean, this most recent week doesn't suggest that. Is that? I mean, do you have a sense of that, and why there's not as much testing happening nationally, and why we might remain steady with our amount of testing, even in spite of national trends?
Yeah, Commissioner, I do agree that there's an element of fatigue in all this. We cannot discount that. Certainly that plays a role in it. We did have a couple of testing events this past week that have, George, I'll finish and give you the floor. We've had a couple of testing events this past week that have contributed certainly to the numbers increasing as well. Anecdotally, from the conversations we've had with some providers, they are seeing 25 to 30% drop in cases, in tests being done as well. So it is a trend that we are seeing overall that is somehow artificially impacted through some of the mass testing events. And I'll give the floor to George to add to this.
Well, I just have a brief thing to add. Possibly the most parsimonious explanation is the case numbers have gone down in the last few weeks nationally. And most people that are tested are still tested because they're either symptomatic and worried, or they believe they've been exposed.
Yeah.
Okay. Thanks.
Yeah, certainly, that's absolutely true. A reflection of our number of tests and the close contacts of those cases obviously will be going down as well, so that contributes. This next slide, Commissioners, is a regional indicator in terms of hospital admissions. So this is from the St. Charles Medical System for the Tri-County region. So these are not just Deschutes admissions. As of this morning, we had 14 COVID patients hospitalized. Less than 5 of those admissions are from Deschutes County. And ever hospitalized stands at 207. This next slide, Commissioners, is the risk level that we have been seeing for several weeks now, categorized from extreme to lower risk. Currently, Deschutes County is in the high-risk category. It's a downgrade since the extreme high we were in for a number of months or weeks. And I think with a trend that we are seeing in the next, maybe not in the next iteration, but the one following, we're probably going to move down to the moderate level, which is really great news for our community.
Nahad, it's Commissioner Adair. So it was 105 last week. So if we go down below that, let's say to 90 this week, then if it's the average, aren't we going to be able to move down with the next report?
Yeah, so I think the next announcement is going to take into account the 2 previous weeks since the last announcement. And that might be, I have to look at my numbers, it might be the 135, week of 135 and week of 105. So we may still not make it, but we'll know more very soon. I think next Tuesday is when the announcement is going to be, if I have gotten this correctly.
Well, our positivity was actually one of the best in the state. I went through the report from Leah Horner, and we were definitely one of the lowest positivities, not the lowest, but we were in an excellent position to go downwards.
Correct. So the next movement week data will be released Tuesday, March 9th, Commissioner. So that's when we'll know. And most likely, I would be surprised if, based on these numbers, we would have any movement. I think the following release, given the trend we're seeing, we might be in the moderate zone. And before giving George the floor, I just wanted to have a moment to share an editorial from my perspective. I make sense out of the world by using football analogies. And what I'm seeing here, Commissioner, based on the numbers, frankly, during the course of this pandemic, is that we started this game by spotting the opposing team, i.e. this virus, 4 touchdowns. And through the perseverance of our committee members, again, i.e. the infection prevention measures, we equalized the game in the 3rd quarter. As we enter the 4th quarter, through the brilliance of our scientists, and that is the vaccine development, we can really take the lead and win this game. However, what's concerning to me, Commissioner, is that we might start celebrating prematurely, and that would mean putting our guards down or relaxing with the infection prevention measures right before we cross the end zone. And the ball could get knocked out, and we miss the opportunity to take the lead and win this game. So from my vantage point, and this is again editorial, we really do need to remain vigilant until this summer. From everything I'm hearing from the White House and from our federal government is that we might have enough vaccines by end of May for everyone who wants a vaccine. And as people get vaccinated, certainly it's going to contribute to interrupting the transmission. Now, this virus most likely will not be eradicated because, frankly, because there's an animal reservoir to this. So we cannot really eradicate, the virus if it has an animal reservoir. So it's probably going to stay with us, and much like the flu, it's going to be probably seasonal, and we probably need booster doses and what have you. Nevertheless, it's going to probably, and most likely, it's going to go down to levels where we can start carrying out our lives in a normal way, like we used to. And we're almost there. Let's just keep our guards up, and let's get to the finish line or to the end zone. Thank you, George.
Thanks. Maybe we can go down to the vaccine slides, please. So we continue to make headway despite a relatively meager allocation the last couple of weeks. We have now vaccinated on the order of 36,000 people, 27,500 of whom have been fully vaccinated. And we continue to have a relatively high rate of vaccination, so 18.5% compared to the rest of the state. Next slide, please. This is the timeline for doses, and you can see that the last week and the current week have been somewhat blunted by the allocation. And in this graphic, the Pfizer doses, or that's the ultra cold mRNA vaccine, is in blue, and the Moderna is in a lighter greenish color. Next slide, please. So we have our, if you will, idealized goal of for herd immunity of 80% of the population. So this is our metric for that. And as I mentioned, we have now immunized around 36,000 people in county. The great majority of them, 27,500, have had both doses, and 8,500 awaiting their follow-up dose. Next slide, please. This is a this slide is remarkable. It was put together at the last moment. So this is our mass vaccine clinic summary. Our appointments are fully booked. When the appointments opened, I believe this was yesterday, and Molly Wells-Starling is on to comment and add content to this, but when appointments opened, there were 25,000 people on the scheduling site. The first 12 minutes, 93% of Thursday's appointments were booked, and 45% of Friday's appointments just in the first 12 minutes. And on the phone, the corollary phone line, there were over 4,000 calls in the first hour, the first 4 hours. Molly, you want to add to this? You're muted.
Yeah, I would just say that this is a huge success for us. As you all know, there have been some issues with the website and the call line. I want to give huge props to St. Charles IT department. They worked endlessly on first adding servers to be able to increase the ability to have traffic flow on that website, and then worked all weekend long to develop a new URL to allow this many people on the site. So to have 25,000 people on this website at 9 a.m. all together and not have it crash is amazing. I think that what this speaks to also is that had we have had 25,000 doses to schedule, we would have been able to do that. So certainly our community is still frustrated, and we are frustrated as well with the minimal amount of doses that we're getting, but we are getting those doses, we are getting these appointments fully booked, and we have a website that is up and running very, very well.
Thanks very much, Molly.
Thank you, Molly, for always responding to my requests. I so appreciate you being on top of the situation. It's greatly appreciated.
Thank you, Commissioner Adair.
Thanks. So moving along, everybody's, I suppose, becoming very familiar with these eligibility criteria and the allocations, which substantially lag. So where we are now, this week, is that the eligibility has extended down through the youngest, if you will, youngest elders, 65 and above. And that means that there's a total of 25,000 residents currently eligible.
It looks like they were all on the website at the same time, too, because that's the number on the previous slide, 25,000 people on scheduling site.
Yes, interest.
I think they were, from what I heard.
Interest and eagerness is high, and everyone is leaning forward on this very effectively here, as well as across the state. Some of the other areas of the state which have been quite behind are doing their best to catch up. So the main issue is just supply, but I'll have a little more to say about that in a minute.
Dr. Conway, I have a question. I was meeting with Dave Doyle yesterday. He happened to mention that his mother-in-law, who is at Stone Ridge, it's termed a retirement facility. The residents there had not all been vaccinated. A nurse brought over 8 vaccines. He actually picked up his mother-in-law and took her to the fairgrounds last Friday, but she is like 92, I believe. So I'm wondering what what category, how did those people, because they're in a retirement facility, are they responsible then to go to the fairgrounds? How do they get their vaccines if the nurse is only bringing 8 at a time?
I'm assuming this is not a long-term care facility because they're separately served and inventoried. So if it's just a progressive, independent level, independent living, and then progressive to other needs facility, those would basically be treated as the general population. So individuals could get that through when doses are available, through their primary care provider or through the mass vaccination site or through the other sites as they're made available. Molly, do you want to add to that, please?
I think you covered it. I think if we have, we're working on homebound individuals and how we will respond to those individuals. So if there are individuals in those facilities, it may be that we are sending teams out to assist them especially once partners in care are approved by the state to do that. So I would say that would be the only caveat, is if they are homebound there, they will meet that criteria. And we're currently working on a plan with partners in care and waiting for the state to approve partners in care to be a provider.
Great news. Thank you.
The next slide, please, Nahan. So this is just a reiteration of what we've offered before. If you have interest in vaccine, go on our site, vaccine.org. And if you need assistance with the form, please feel free to call our hotline, 541-699-5109. Next slide, please. So this is a well-worn pathway. The left is the phase 1A, which of course is healthcare workers and various affiliated persons. And now we've been working our way down through the elderly, and we're down to group 5. So we're basically, the eligibility extends to all persons 65 or over. Starting at the end of March, though, we'll be adding a very large number of persons that would be people that are between 45 and 64 with one or more underlying health conditions. I'll talk a little more about those in a moment. Migrant and seasonal farm workers, seafood and agricultural workers, and people living in low-income senior housing or senior congregate and independent living. And actually, this would also encompass, Commissioner Adair, your question for persons that either were not picked up or don't meet the age criteria, that persons in such settings would also be eligible. Individuals experiencing houselessness or homelessness, and people currently displaced by wildfires, and then also wildland firefighters, very importantly. Starting on May 1st, frontline workers, multi-generational household members, and adults 16 to 44 with one or more underlying health conditions as defined. I'll talk about that in just another moment. And then after that, in June, people that are between 45 and 64, and then starting July 1st, all Oregonians. And what we're hoping is that this time frame will actually be somewhat collapsed, in that we're hoping that there'll be much more robust vaccine supplies so that we can hurry up. Next slide, please. This is a complicated slide. It won't project very well for detail, but I'll just point out what's here. So this is a list of the underlying health conditions with increased risk. I will point out the fourth to last, obesity, BMI greater than or equal to 30 kilograms per meter squared, it's very common. This is in the U.S., typically between 30 and 40% of U.S. adults would meet these criteria. So this adds very greatly to the number of eligible persons, while many of the other things are serious health conditions, including multiple metabolic and other diseases, immunocompromised, et cetera. And then frontline workers, there's a very long, detailed definition of that. And these are all available on OHA's website. Next slide, I won't even, sorry, that's that one. Okay. This is Frontline Workers, a little more fine detail from OHA's website. So the ones eligible early, March 29, food and agricultural workers and wildland firefighters. Next slide. And then May 1st, other frontline workers. And the concern here is that people in this type of work that cannot be performed from home also are either in regular close contact with others outside their household, less than 6 feet away, and routinely in close contact with others outside their household. Next slide. This is on OHA's website. This is the long list of essential workers, and I would refer you to the site if you want to understand that better. Next slide. So we have had good news on the vaccine front this week. Last, I think it was Thursday, FDA's Extramural Advisory Committee strongly recommended that an emergency use authorization be granted to the Johnson & Johnson / Janssen biomedical candidate vaccine, which is a different vaccine. It's a different design. It's an adenovirus-based vaccine, DNA, and it doesn't require the type of special handling that the ultra cold and the cold vaccines that we've been giving require. This authorization, and then so they recommended it Friday. The FDA considered it. They went on until Saturday. FDA elected to issue an emergency use authorization. Sunday and Monday, CDC's Committee on Immunization Practices met, ACIP, and by close of business on Monday, they strongly recommended the vaccine as well. So this has sort of been thrice blessed now by expert groups. The phase 3 study, which is the effectiveness study, enrolled over 44,000 participants. And what distinguishes this is that, just as a matter of chance, this study happened to be when there was a very high incidence of COVID in the United States broadly. It offers substantial protection, especially against severe COVID-19, including hospitalization and death, irrespective of variants. This does not appear to be sensitive to the variants that have become common in the recent past in North America. It's well tolerated and safe, and single dose, and the transportation and refrigeration requirements are just that, just refrigeration and gentle transportation. Next slide. So this just summarizes the evidence for this and the other vaccines. So all of the 3 authorized vaccines have not been assessed in a single collective trial. So they differed by calendar time and geography and different types of environments as far as circulating virus and the incidence. As I mentioned, the Johnson & Johnson Janssen vaccine was tested under the most highest incidence, so it had the most challenges to it. All authorized COVID-19 vaccines demonstrate total efficacy, which is ranging from 65 to 95%, and that's against any symptomatic lab-confirmed COVID-19. So that's what's called your overall efficacy. But the most important thing is the efficacy against serious problems. And all of them performed at 89% or above against COVID-19 serious enough to require hospitalization. In the vaccine trials, no participants in any of these 3 trials who received a COVID-19 vaccine died from COVID-19. So if you do the math in your head, it's over 100,000 subjects, so at least 50,000 people immunized. None died during the vaccine trials. There were deaths among individuals that were given the placebo or the control dose of just aqueous and water water-based solution in both the Moderna and the Janssen trials. Next slide, please. So this really just reiterates that this is about specifically about the Janssen vaccine. Overall 85% efficacy globally measured. And the most important point is that the complete protection against COVID-19 related hospitalization as of day 28 and no COVID-related deaths compared to 5 in the placebo group or the control group. 72% vaccine efficacy against moderate to severe or critical events in COVID-19 in the U.S. And then, as I mentioned already, 66% broadly across other countries. And then a similar vaccine, and this is interesting because this is a much larger study, 44,000 subjects. So they actually were able to stratify by age, comorbidities, which are the other illnesses, sex, and then race and ethnicity. And it appears to be durably effective across all of those different variables. So anyhow, this is now, it's been in production for a while. There's 4 million doses are being distributed nationally. I believe this week, we've been told that we'll be receiving about 400 doses of this, I believe in the next day or two. Molly, do you want to add anything about the logistics and what's headed our way?
Yeah, we are receiving 400 of that vaccine probably today or tomorrow, and then we are coordinating with pharmacies to get that vaccine out. So there are, as you know, there are pharmacies who are getting federal allotments of vaccines, and we are working with the other pharmacies who can provide vaccine who will not be getting federal allotments to get these vaccines to them so that they can get our community vaccinated.
Great, thanks. So now it's Dr. Michael Johnson, who's the senior data scientist for St. Charles System, should be online with us, and he may need to be admitted. There we are. And we've gotten a lot of questions about the sort of coverage of the vaccine at a much more granular level. And Dr. Johnson's put together an excellent presentation. Having seen this a couple of times last week in different settings, I thought this would really add to the presentation today if he would kindly walk us through his findings, which I think he actually updated especially for this event just yesterday. So, Michael.
Thanks, Dr. Conway, and just want to give a shout out to both Nahad and Molly for so many of their comments up to this point. I'm just in complete agreement with everything that's been said thus far, and I think you guys are really highlighting the things that at least I think are important. I would like to point out that through these slides that I'll show you today, they come from a slightly different perspective. The fact that I'm a caregiver here at St. Charles, most of my efforts are to, with regard to the resources and the support that's necessary for us as a health system for the pandemic. So it does have that bent to it, but I think that a lot of the information certainly applies across the entire Central Oregon region, so I'll get on with it. But I should mention that I will try to pause throughout these to entertain any questions as they come along, and I certainly welcome any comments from any of the other panelists that would like to add to it. So some of the information on this first slide is simply, to be honest with you, archival information for me as we go forward, so I knew where this is coming from. It appears I have a questionable connection. Hopefully I'm not breaking up too much.
It sounds good on this side. Thank you very much.
What I'd like... Okay, thank you. I think that a couple of key things that I'd like to highlight off of this slide is I know a lot of the information, basically anything that I'd like to know with regard to the details of the vaccinations that are administered by St. Charles or anyone out at the fairgrounds. However, there's a lot of detail for about a third of the vaccinations that are administered by others. and I'll get into that a little bit later. So the real reason that I wanted to dive into these kinds of details are shown on this particular slide. So this compares the proportion breakdown of our population throughout all 3 counties. And you can see that the age groups along the bottom. The orange band is the proportion of the population they represent, and the blue bars represent their representation as hospitalized COVID patients. So you can see the overrepresentation begins as early as the 50 to 59 age group and is really pronounced for anybody 60 and above. So the idea here is, with a successful vaccination program that strategically is aimed at those other age groups, we can, well before herd immunity, impact the hospitalization rate, and which, as I mentioned before, is a major concern of mine, because that impacts how we support this with staff and PPE and hospital beds, et cetera. So decreasing the hospitalization rate nearly in half if we just successfully vaccinate those that are 70 and above. So that's kind of the reason I'd like to know the details, so I know how far along we are progressing toward that. A little bit more background, so when I use terms, you know what I'm talking about. I lump together frequently Deschutes, Crook, and Jefferson counties, because those are the 3 counties that we support as a health system. And I think the rest of it here is fairly straightforward. I'll just give you a moment to read that. It is important to note, and this was something that was pointed out by Dr. Conway last week when we were talking, that this hospitalization rate for the elderly is likely a conservative estimate, because many of those elderly who came up positive remained in their long-term nursing facilities, where if they were not in a facility like that, they would have been hospitalized. Here's a quick snapshot as of yesterday, and actually it didn't change much because we have not administered any St. Charles administered vaccinations in the last several days, just because of supply. You can see here that 48,000, almost 50,000 vaccinations administered as of the 1st, and there's a total of across all 3 counties, almost 75,000 administered, to include all the outside agencies. So let's take a look at some of the nitty-gritty details. Excuse me. So this is a day-by-day vaccination. It displays the number of vaccinations, it's both broken down for Pfizer and Moderna, dose 1 and dose 2. So across this time period, since the about the 1st of the year, if we have vaccinations, we've on average administered over 1,000. And talking with our chief pharmacist, we could easily vaccinate, twice as many as what we have done up to this date if we had the supply. So that's kind of an interesting perspective. If you take a look at the cumulative total of the total number of vaccinations, see this. Let me point out a couple things. All these flat regions are because I'm pausing for my internet connection here. So the flat sections are because of supply. And you can see the most recent flat section. And it is nice to see so many of those second doses coming into play. Now let's take a look at where I have to start doing some estimations to get all of the vaccinations. So here, all the outside St. Charles administered ones by the VA, by the IHS, by the Federal Pharmacy Program, and the Federal Retail Pharmacy Program. So here are the daily counts taken from the OHA website. And these, there is a little bit of a lag in the data for the last 2 or 3 days. But the fact that the supply has been low, there's not going to be a lot of change here in these most recent days. The cumulative effect of the or not the effect, but the cumulative count of vaccinations over time, and you can see how the 3 counties share that. So now, from my perspective, where we get into the really interesting things, let's take a look at how these vaccinations have been distributed by age group. Here's where I'm getting my data from the OHA website, as well as a couple of websites necessary to make population estimations and population growth estimations. I'm kind of constrained by the age groups that were used for these population estimates, and you'll kind of see that as we go forward. This next bullet, there is still some concern that we are not accounting for all the vaccinations. I'm trying hard to get information on whether or not the Indian Health Services, the VA, the Federal Pharmacy Program, and the Federal Retail Pharmacy Program are in fact reporting their numbers through the alert system. Dr. Conway, an update on that, just as of this morning, I did hear that our chief pharmacist reached out to several of these people that he knows in these agencies and heard back from one of the managers at Walgreens that they are in fact reporting all their numbers to the alert immunization information system. So the Federal Retail Pharmacy Program should be including their numbers. The other ones, I'm still trying, I've reached out to several to get more information on that. So let's get into it. These are the St. Charles administered vaccinations. I have full confidence that these numbers are very accurate. They're the ones that are administered by St. Charles, either here at the hospital or out at the fairgrounds. And you can see that these huge spikes out here on the right-hand side showing our vaccination strategy. In comparison, this is from the OHA website for the entire state as of yesterday. And again, there is a little bit of a lag in these data, but Nahad and Dr. Conway have both seen this chart before, and when I first showed this, there was no spike out here at all to the right, but you can see that they are starting to catch up. But it's not as pronounced as here in Central Oregon. I attribute that primarily to our ability to be kind of the first out of the gate. We got a head start on the rest of the state, so we are a little bit more mature, if I can use that term, with regard to our strategy. So we have been very, very successful in targeting those older age groups. When you take a look at the vaccinations, not by count, but by proportion. So what proportion of those older age groups are we successfully administering vaccinations to? So the difference becomes even more stark, as you can see in this chart. So quite promising that we have over half of those 80 to 85 and 85 plus, in those older age groups, that have started the series. And that's just for this chart showing just the St. Charles vaccinations. If I extrapolate that and assume that the other third of the vaccinations that are being administered are following the same proportion per age group as we are, then you get these kinds of numbers. So we are very close to reaching, if not, depending on who you talk to, in that one age group, that small age group here, herd immunity. quickly approaching it in everybody that's 70 above. This is just great news, in my opinion. I have two more charts here. They basically are the same information that you just saw, except it's a different visualization. So this breaks down all those age groups into 100% stacked bar chart, where you can see these three mutually exclusive groups. The blue being the group that have only gotten the first dose, the orange being fully vaccinated, and the brown bar, or excuse me, the gray bar being those that have not even started the series. So these are the St. Charles administered, and these are the projected for all vaccinations who are administered. So it's kind of a rapid fire approach. I certainly will make all of these slides available for distribution. Feel free to reach out to me. Contact information is down here, or you can easily get a hold of me through any of the other panelists here, I'm sure.
Well, thank you very much for providing that information. It's good to know that we have that capacity. Your position really running those numbers. Each week we're seeing X amount of more vaccines going in, so the numbers are going to start to fill out. So it's good to have kind of this format that you're even presenting to us. So thank you so much. The stream was a little choppy today, but I think we heard the whole thing.
All right, thank you.
I'd like to circle back and ask a question to Dr. Conway and Molly and
back
Han.
over to Dr. Conway.
Yep, thank you. So yeah, Doctor, there you go.
So my question is about people in the 70+ bracket. There, last week or in the last few days, we received constituent comments from a number of people who were trying to sign up during that period when we hadn't our technology, the website and the phone system hadn't quite caught up yet. It sounds like we've made some good progress there, but if there are people who were trying to sign up during one of those really jammed up periods, were not able to get through, are 70+ and are still working on getting signed up now, do you have any sense of where they're going to fit in the kind of timing priority of vaccines administered in the next few weeks? Will they fall behind people who are 65+ who just signed up, in that last wave yesterday, or will they, does our system sort for them and kind of put them ahead, or how does that work?
So I think Molly might be the best respondent to that, but I will say that we're trying to engineer this in a way that there isn't the bias that you mentioned, where the younger elders would be preferentially accessing this. And one of the ways we're doing is we're protecting a substantial portion to be handled by phone appointments rather than just online. So there is a race that's taking place online. The phone is a little more deliberative and structured. Molly, do you want to elaborate on that?
Yeah, I think it's a great question. And as George said, as long as we don't have a full supply of vaccine, there is constantly going to be a race for this. However, I think it's really important that we try to adjust for that, especially with our older adult vulnerable population. So one of the things that we did this week for these doses is we held a certain percentage aside for our 70+. So this is all in the background through our website. We had a certain percentage for 70+ and a certain percentage for 65+. So if you went into the website to sign up, you would click either 65+ or 70+, just so that we can try to get through those 70+, and then to the 65+. We also, as Dr. Conway stated, held back about 10% of our appointments to be on our call line for those individuals who really just struggle to sign up on the website. And so those individuals could call, and the call line would assist them. Again, we don't have a sufficient allotment of vaccine, so there is still a constant rush for that. I think also in the coming weeks, next week, we're going to be doing some pop-up clinics. And through those pop-up clinics, we will be using our vaccine interest form. We will be sorting by age, and we will be focusing on our 70 plus for those clinics, just to try to get through that population. We will be calling those individuals off of our vaccine interest line. So this is just a plug for our community to make sure they go onto our vaccine interest website and fill out that form. And I'm going to give you that. That's www.deschutes.org/COVID-19 vaccine. So really important to sign up on that form so that we can call and get people signed up.
And actually, if I may add, anyone that's having trouble populating a form can also call in on our vaccine hotline and be assisted with that. And just one other thing, Commissioner, as a matter of policy, the direction that I've been giving is that we want to be working our way from the very oldest downward in age, and we're doing our best to do that. So that is our intent, and the stratification of the 70 and above is one way of chipping away at that.
Thank you very much for building those, building those kind of those preferences and reserving some allocation for the oldest seniors in what is a very dynamic and intense process with thousands of people trying to sign up per day. I'm sure those folks really appreciate it.
Okay.
So I just wanted to give a message to Molly. Molly, I had someone I was helping yesterday. They're helping someone who's 88. They were unsuccessful, so I will be sharing information regarding that person. Hopefully their helper can get something resolved for this gentleman who is a Deschutes County resident and 88. So, it's always those special situations. And then I think I had a couple in their 70s. So I do honestly believe that we need to give priority to 70 and above and, get them taken care of and then go down to 65.
Commissioners, if I could just ask your forgiveness, I have to get off for the statewide vaccine allocation call.
Very good. Well, thank you very much. It's been a valuable hour here for this COVID-19 update. Are there any other questions or thoughts from commissioners?
Thank you all again for all your work.
Yes, please.
Can I add one thing? I'm so sorry. I just want to make sure to get out to our public that URL for signing up when we do have doses released for the mass vaccination clinic has changed. So it's www.centraloregoncovidvaccine.com, and that is on our website. That's really important in the future when those doses are released and when we have our mass vaccination clinic sign up, that people go directly to that website rather than the St. Charles website. This is the website that has the capacity to handle the 25,000 plus people.
Molly, could you repeat that just so anyone who didn't write it down could clearly listen to what you said?
Absolutely. www.centraloregoncovidvaccine.com.
Thank you very much. That's what I thought. It's not COVID-19 any longer. It's just plain COVID. So thanks, Molly.
Thank you.
Also, each week we're improving, and that now we can handle 25,000 at a time on the website at least. If we had vaccines in that amount, we could sure spin up to that also. So thank you so much for joining us today, and we will see you next week or before.
Thanks again for all your work.
Thank you.
At this time, item number 10, a pandemic financial assistance update. This is also our weekly update on the financial aspect of this effort. Greg Munns joining us.
Good morning, Commissioners.
Hello. please take it away if there's any current updates for this week.
Yep, just a short update this week. As I mentioned before, I just want to let you know that we're continuing to work on the reimbursement from FEMA for the mass vaccination center. And we're actually going to bring on some additional help to assist us to get that work done and balance some of the workloads in, between finance and health services. There's a lot going on, and we're finding that we've tried to do this independently, but at this point we're going to bring somebody on to help us who actually has a little bit of a background in it, so it'll help us get kickstarted a little bit faster. And just in terms of some things I've probably mentioned in the past, the FEMA reimbursement, historically we've talked about a FEMA reimbursement being 75% of eligible disaster costs after the fact. This program that FEMA is running now for the vaccine centers is 100% reimbursable, and for vaccine centers. And they're actually dividing those up into projects or phases. So the first initial project that we're in right now is a 90-day period going from January 21 to April 21st. So I've mentioned that in the past, but I just want to give you a little bit of context again, real briefly. So that's what's going on there. The CARES Act, we have had some staffing shortages, so we haven't been able to request our last reimbursement on that, but we expect to be able to do so and have that wrapped up by the end of the month. At that point, I'll have a report for you. Also on the funding front, as you know, last weekend, I think it was on Saturday, the House passed the $1.9 trillion stimulus bill. It's known as the American Rescue Plan. The bill is on its way, or is in the Senate now, and is expected to pass in some form or another by March 14th, when the unemployment benefits from the last pandemic response will expire. The interesting part about the bill is it includes financial relief for state, local, and tribal governments, specifically $65.1 billion in direct allocations to counties. This is not funds allocated like the CARES Act dollars were allocated, which in the case for Deschutes County went through the state. This would be direct to the counties. We don't have any specifics on the details of how that funds are to be used, other than some sort of general big picture parameters, and I've got a list of them here. That it's to respond to or mitigate the public health emergency with respect to the COVID-19 emergency or its negative economic impacts, cover the costs incurred as a result of the COVID-19 emergency, replace revenue that was lost, delayed, or decreased as determined based on the projections of the government by January 27th, and address the economic impacts of the COVID-19 disease. So you can see that these are pretty broad, but that's what we know right now. The other interesting point of this is that there's an estimator that's been published. If the bill was to pass as it was written or introduced, or at least passed through the House, the direct payments calculator shows that Deschutes County would receive about almost $39 million in support. So more on that as we move forward, but I thought I'd give you a quick update on that. And the one last piece is that given the slowdown and the pace of change in the pandemic funding information and the required feedback that was needed from the board during the CARES Act funding period, I'm suggesting that if the board is interested in this, that the weekly placeholder on the Wednesday agenda, this one here, be removed, and that I simply tag on to the back of Health Services COVID update, or during my monthly financial update to give you updates on pandemic funding.
Great. Well, thank you for that suggestion. We're close to that. We know we've talked about going to a biweekly COVID update, and then the thought process is when we step down to the next level, state priority level. So we're close. Any thoughts, commissioners, about not having this as a separate agenda item specifically at this time?
That works for me. I think
Okay,
I think that's reasonable, and we can always have you, I mean, if we went to staggered, every other week or something like that, if there was an urgent, if there was a week where there was urgent news, we can always increase the frequency just for that week.
Yep. So I support that. Just plug it in if there's a COVID update, plug it in when needed. Thank you very much for keeping up to date on what's happening at the federal and state level.
Greg, I just want to reconfirm what you just said, because I was doing my own little personal calculation of how Oregon is, what a part of the United States population, we're like 1.2 or something. Okay, so you're saying directly that with this calculation, Deschutes County may be receiving up to approximately 39 million? Is that what you just said?
That's
okay.
Correct.
Okay, yes, it does follow through, and we would get that funding directly, not going through Salem and then asking to be reimbursed. So it could definitely be very helpful. And at that point in time, when we know that that kind of funding is coming, I think we need to have weekly updates. 39 million is going to be way more than 6.4 million. So.
Agreed. Yeah, exactly.
Greg, one other question. So I'm still wondering about the December COVID relief bill, and it may be because it didn't have a specific allocation for state and local support. It's just not going to be meaningful for us. But do we have any sense of whether there are components from that relief package that are going to be that are things that we should be keeping track of for the county? I mean, for example, I know that there was money in there for schools, I believe there was money in there for schools, and so they want to be keeping close track of that. But that's not necessarily; those aren't necessarily dollars that we need to be accounting for. So I'm just wondering whether there was anything from that December relief bill that we should be keeping track of.
Yeah, that's a good question. I don't think so at this point. But again, this is a fairly fluid operation. And I think what is helpful is that we stay on our toes, and we are keeping our ears open and on the ground, and we really expect this to change almost on a daily basis. So that we're just prepared for that. But in terms of anything having to do with the end of the December funding round, there's nothing specific at this point.
Thanks.
Okay, thank you very much for that update. So at this time, there'll be lunch recess, and we're going to be coming back with deliberations on the TSID hydroelectric facility. So Commissioner Dare.
You don't want to talk about the letter for the Sisters Rodeo at this moment?
I was just going to get to other items and see what else we want to get done right now. So thank you very much. Also, we do not have executive session today, correct? There's nothing else. Yeah, so that's my point, was confirming that, the one more item after lunch. So there's a proposed letter discussing an ask to the governor's office. You want to?
I did actually talk to Annette Leva last night. She said that the governor, they're going to be updating the outdoor parameters shortly. So I was really happy to hear that the governor is looking at those guidelines, and apparently they're going to be, I hope you could say, lightened for our community.
Yep. So this letter is asking for an OLCC approval because it's kind of a catch-22 for the rodeo. If they don't have sponsorship or OLCC approval for sales, their whole thing just doesn't quite come together. There's a letter provided by the Chamber of Commerce with the Sisters Rodeo Association and people to sign. So I had received that, and I'm proposing that we sign a letter. The concept here is a provisional permit. So it's a shame because, what's the future going to look like in COVID? We don't know.
Well, I thought it was unfortunate to read that they are not going to have the parade. So, Commissioner Chapman, I can practice riding another year before we get to ride in that rodeo parade. But you know what? They have ways to get in, keep their crowd separate, all that they need to do. But I know that the OLCC permit is incredibly beneficial to their program. The underwriting is huge. Spoke with Frank Jacobson, and I believe signing this letter is really important for the impact of the community. Last year, not having it was rather devastating for the amount of funding that they spread out to the community from this enormous event. So the 80th anniversary, it's actually will be the 80th rodeo. Last year, I think it was the 80th.
That's what I was gonna
but this
say.
year will be the actual rodeo. So yes, I move board signature of the letter to Governor Brown, and hopefully we'll get some excellent news shortly from OHA and the guidelines.
I'm sorry, I missed this letter in my box. If it was in the box, I thought I combed through the box pretty carefully this morning, but I did not see this letter.
Yeah, okay, so you haven't seen it yet.
So do we need to bring it back then?
I think I'll be with you in a minute.
Yep,
Okay.
There we go, standing by.
I guess I shouldn't say anything else to him. If he's reading, I don't want to interrupt.
Okay, so this is requesting a provisional permit, and if guidelines have not been changed by June, then the event will be canceled. So I'm
Well,
is
so,
that
yeah, from a governing body's point of view, we can't say, we want to do it. I mean, we're supporting Sisters Rodeo, but it's really that provisional request. It is in a COVID environment with procedures and protocols in place. So.
Mm-hmm. Yeah, I'm good with this.
So is that a second?
A second.
Okay. So for discussion, there's just a statement in here. So it talks about to make it possible for us to have the event, and I'd just rather see it say for the rodeo to proceed, just because we're advocating for a community event, not the county's event, but Sisters Rodeo's event. So you see where that is.
Yes.
So do you
That's
support
fine.
that? Yeah, so that's
Support
okay. Well, with that, any other discussion? I'll call for the vote. Commissioner Adair?
Yes, absolutely.
Yeah. Commissioner Chang?
Yes.
And chair votes yes. So that'll be a letter of support to the Office of the Governor for the Sisters Rodeo. Are there any other items?
Oh, I do want to make an announcement to the community that the American is going on in Texas, starting tonight, I believe. And it's we have local contestants, I'm hoping, down there. So anyway, it's they have the opportunity to earn up to $1 million. So it's a really enormous contest, and we'll finish up this weekend.
It's an all-around rodeo event?
Yeah, it's all events, breakaway for women, barrels, the whole rodeo. And if you've made the national finals, the top 10 are automatically participants, but then they've had 450 ropers, women that rope, breakaway roping, and they're down to, I believe, like the top 40 will be competing the next couple nights, and so it should be quite fascinating.
Very good. Anything else, other items?
We do have to, I noticed that our legal had given us his evaluation annually, and so I believe we're going to be discussing that on March 15th. So that will be very timely, won't it?
There you go. So, yeah.
So just want him to know we're not forgetting him this year.
Okay. Well, seeing nothing else, we'll reconvene after a lunch recess at 1 o'clock. Commissioner Dare has joined us at the reconvening of this afternoon session.
Yes, but I will be recusing myself now because I do have a conflict of interest. So, but I'm on my way to go talk to a brewery owner. We've seen the tax that's been proposed. So, going to go talk with the local community at this time.
Great.
Have a wonderful meeting and good luck.
Thank you very much.
Thanks.
Commissioners.
So this is deliberations on this topic. Tarek Rawlings, please take it away.
Sure. Thank you very much, Commissioners. And for the record, Tarek Rawlings, I'm an associate planner with the Community Development Department. And today, like you said, we have deliberations for the Three Sisters Irrigation District's request for a new hydroelectric facility. I've prepared a decision matrix. There should be a copy in front of each of you. This is essentially a decision-making tool. It's a summary of the materials and information in the record, as well as the legal arguments put forward by the various parties involved. It's not a replacement necessarily, those details. It's just meant as an informational tool to help you reach decisions on each of these issue areas. And so with that, the format of this matrix is it highlights 10 different issue areas. They're numbered 1 through 10. My plan today was to kind of go through whichever order is preferred by the board, but I would typically start with the description of the issue area, some insight into the hearings officer's findings related to those issue areas, and then the actual question before the board in terms of answering the, kind of the central questions for each of these issue areas. So I'm happy to go in the order 1 through 10 or however you'd prefer to go forward, but I would just look to you at this time to in how you'd prefer to proceed.
Great. Well, thank you very much for the matrix. That's probably going to help us stay a little organized here. Any thoughts?
Yeah, I'm happy to go through the matrix in this order. I do think that many of the issues raised, or many of the criteria, relate to this question of whether the quantity and timing of diversions from Wycheese Creek are going to be different after this project, after this hydro facility is built, and so kind of as like a foundational question, I wanted to bring that up, but and so I'll kind of return to that over and over as we go through 1 through 10, I think.
So quantity of water and timing of that.
Yeah, and as I was working my way through the materials, I kept, I was basically that's one of the things I was really looking for was, has the Three Sisters Irrigation District, demonstrated that their diversion is not really going to change because of this project. It'll, basically they will divert water for the purposes of irrigation, and then, the hydro generation will be a secondary to that. And I was also looking, through the information that Central Oregon Land Watch provided to see if they made a compelling argument that for some reason or another the timing and the quantity of diversion was going to change. And so I guess I kind of to give you my perspective on that, I did not feel like after trying to carefully review the materials, I did not feel like I saw a compelling argument that the diversion timing or quantity was going to be changed as a result of this project. So that'll color a lot of the way I look at issues as we work through 1 through 10.
Great. Well, and just a kind of a high-level observation from myself is the fact that, when we talk about a hydro facility in the county code, I got to imagine that nobody was thinking that, the second use downstream on a side flow of irrigation, because it's all kind of talks about, in-stream decisions and in-stream management. So, this scenario probably wasn't even specifically defined in our code. So then it brings me to the concept that, if this is going to be something that we're setting direction to one way or the other, there may be an opportunity to go back and just, clarify words because of this application
Yeah.
Itself, but that's a future project.
Yeah, no, I 100% agree. I mean, I think when the code was written, they were picturing a dam that impounded water behind it,
In
or
a natural flowing river.
yeah, or something like the siphon project. That we have a little side diversion, and then, but it's right on the river, and then the water goes back into the river. Not, that I'm wondering whether our code needs to be reviewed to deal with in pipe, in conduit hydro.
Yeah. So just acknowledging the same thing.
Yeah. Yeah.
Okay, well, so yeah, let's start at number one. Thank you for the matrix. These are always valuable just as a tool to kind of work through our steps here of decisions.
Certainly. Yeah, did you want me to just dive in, Commissioner?
Yeah, so what we'll probably go at this one, we may kind of read the whole content. This is kind of a meaty one, but we may not do that with all of them, just letting you know.
Certainly. Yeah, so just to take it away, the first issue area here centers on whether the county's exclusive farm use code requires compliance with the OAR that's listed on your matrix there. There is initially a finding in the hearings officer's decision of denial because of essentially a position by the applicant, that initial position by the applicant that the OAR had been codified in exclusive farm use code language. Since then, the app, and even within the hearings officer's decision, there's acknowledgement that there is likely sufficient evidence to address that OAR. And then since that decision, there has been additional information added to record by the applicant, further addressing the line items of that OAR. And so really the question before the board today on this particular issue area is whether there is sufficient evidence in record addressing the OAR requirements. If yes, that you find that it is sufficient, we can move to an approval on this issue area and overturn the hearings officer's finding of denial. If no, you find there is not sufficient evidence, then we can uphold the denial findings on this particular issue area.
Sure. So yeah, the written testimony in the record definitely makes a case for this, documenting the ORS 330130, section 17 and 22. So, as they step into that, that's their case. And I would support that is in the record and it's appropriate.
I would agree.
Okay. So there we go.
Thank you very much. So just to clarify, it's both of you have found that there is sufficient evidence addressing the OAR requirements.
Yes.
Yes.
Thank you very much. All right, so the second issue area, and these are our there's two easy ones in the beginning and two easier ones at the end, and all the stuff in the middle is going to be a little bit harder. But the second one deals with whether the hearings officer erred in finding that the applicant did not meet the dimensional standards of the county's MUA 10 zone. The hearings officer denied the application on this ground in that there was not 10 acres at least of this MUA 10 zone on the property. I'm just going to put forward just that we have in our own county exceptions chapter an allowance for these parcels that may be smaller than that dimensional standard size to still pursue and receive approval for allowable uses. And that's been a pretty long-standing policy there, that we have allowed things on parcels that don't necessarily meet that dimensional standard. But still, the question before the board for this particular issue area is whether the MUA 10 portion of that property does need to be 10 acres in order to comply with this. If yes, then we can adopt Landwatch's findings or proposed findings and continue to deny the application on this ground. And if the board finds that no, 10 acres is not required, then the board can overturn the hearings officer's findings of denial and move to an approval on this issue area.
I think we should, I think because we have an exception allowance to allow developments on parcels smaller than 10 acres in size, that we should vote to overturn the hearings officer's findings.
And I agree with that also. Yeah, just a long-standing So this is that history of, the first versions of land use and the first versions of zoning following 1973 with previously parcelized lands in Deschutes County. So long history of this. So I support, disagreeing with the hearings officer.
Very good. And just as a recap, it sounds like both commissioners are voting to overturn the hearings officer's findings of denial, correct?
Yes.
Correct.
Very good. Thank you. Okay, and then moving to our third issue area, this deals with whether the hearings officer's decision erroneously relied on the applicant's water rights to demonstrate compliance and applicability with subsections A2 and A5, which are listed on your matrix there. The hearings officer specifically found that A2 was not applicable. There was not an impoundment included with the proposal, and then went on to specifically find that A5 had been met because there was no evidence of increased diversion. And so with that, the question before the board is kind of a phased series of questions, but the first would be whether the board finds that A2 is applicable to the subject application or not. And again, the hearings officer found that it was not applicable.
I think this fits right into that kind of terminology problem we have, because the impoundment would generally be in that natural flow of river, the effects of that, and so this is not part of this application because it's the second use down pipe from this diversion. That's the first part of it.
Yeah, as I stated in the beginning, I to the best, as best I can tell, this project doesn't have an impact beyond the diversion point. It doesn't have an impact beyond the basic diversion for irrigation purposes at the irrigation point, at the point of diversion. I don't see impacts beyond the existing or kind of the baseline diversions that are already occurring.
Sure, and just maybe to narrow down in on that a little bit, so for the specific findings of A2 where there's the mentioning of that term impoundment, is it the commission's position that that is not an applicable criterion?
I would agree, which is what the hearings officer had determined.
Right. Sorry. Yeah. To get to the specific code language, I don't believe there. In this case, the word impoundment is really not applicable to this situation.
Okay, and so it sounds like in concurrence with the hearings officer's findings, the board is agreeing that A2 is not applicable to the subject application.
Correct.
And so the second part of that question is whether A5 applies to the subject application. Again, the hearings officer found that it did apply and that it was met through the applicant's burden of proof.
So yeah, it's interesting because we read the words and then digest it in our head, and then you're already speaking like the written solution here. So we got to get all these kind of lined up.
Yeah. So on this one, because I don't believe there will be impacts beyond the current irrigation diversion at the point of diversion on Waichus Creek, I would say that we are maintaining existing fish and wildlife habitat, and we won't have adverse impact.
Okay, and so from Commissioner Chang, it sounds like that is a finding that it is applicable and that it would be met because there is no additional adverse impact.
Correct.
So, and I would conclude the same. So yeah, it is applicable.
Okay, very good. Thank you very much. Applicable and met. So on to the fourth issue area, if we're ready.
Yes.
This has to do with whether the hearings officer's decision misinterpreted the term affected stretch of river. Again, these are going to kind of overlap with a lot of the same ideas we're talking about here. Specifically, these subsections are A3 and 4 and A6 and 8. The hearings officer found that A3 and 4 were not applicable as there was not an affected stretch of river included in the proposal or the subject property as related to A3 or A4. And then the hearings officer found that A6 and A8 were both met, essentially because there was not going to be any kind of material impact to White's Creek based on those two criteria. So similar to how we structured the last issue areas questioning, the first initial question would be whether the board finds that A3 and A4 are applicable to the subject application. And again, the hearings officer found that neither of these were applicable, A3 or A4.
And I would agree with that at this time.
I would agree with the hearing officer on that as well.
Very good. And then the second question here has to do with A6 and A8. Same question. Does the commission view A6 and A8 as being applicable to the subject application? Again, the hearings officer found that they were applicable and that they were met, in that there was not going to be any additional material impacts to White's Creek.
I also think that they are applicable and that they are met. The affected stretch of river is in my perspective, the affected stretch of river is downstream from the point of diversion, but we are not making any kind of a change to the affected stretch of river with this project.
And I would agree.
Okay, very good. And moving on to the fifth issue area, thank you for all the efficiency. This one deals with whether the hearings officer's decision erroneously found that the criterion listed in the various subsections on the matrix there are not applicable based on the interpretation of the phrase maintain or enhance. The hearings officer found that those subsections all were not applicable, essentially because this phrase presents a choice to the applicant whether to maintain or enhance. The applicant has proposed to maintain in all applicable uses of that language, essentially in their burden of proof. And that's obviously being challenged in this issue area. So the question really before the board is whether enhancement is required to meet this to meet these various criteria. This would likely be in the form of river or wildlife enhancement plans. If the board finds that enhancement is required to meet these criteria, then the board can deny this application for a lack of such enhancement plans or enhancement information. And if the board finds conversely that no enhancement is not required, then they can adopt the hearings officer's findings that these are either not applicable or that they are met.
I think this is that same scenario where, if you're working in the natural flow of the river and you're affecting it, here's the plan, this is what we're going to do. But once again, it's just this is the second step downstream, down irrigation pipe from this. So, yeah, I think the hearings officer did a good job defining this once he was able to get the context of this also.
Tarek, I'd love to ask if I was somewhere in so this basic question of this question of whether it's enhancement and maintain or enhance, or whether it's maintain or whether it's just maintain or enhance. I mean this is a big point of argument. Can you point us to are there places in the code where those things are separated, where it just says enhancement as opposed to maintain or enhance?
So there are, and this is going to be a little convoluted, but the hearings officer's decision essentially takes it that step further that you're describing, Commissioner Chang, where any use of the standalone term of enhancement was basically deemed to be not applicable by the entire criterion would be not applicable under the hearings officer's understanding because the applicant had opted for this maintenance option. If there's ever a specific discussion of only enhancement measures, the hearings officer consistently found that those did not apply and that they weren't required.
And that ties back to to these questions about the affected stretch of river and the diversion, you know, whether this project will result in a change in the diversion.
Correct. Yeah, and these are all essentially to be these mitigative sort of technical mitigative plans and information that are exactly really directed towards kind of riverine and wildlife health and you know, whether it's specifically the term enhancement or that phrase maintain or enhance.
Okay. Yes, then I'm going to agree with the hearing officer's interpretation as well.
Sure. So just to review, it sounds as though both commissioners are agreeing that the phrase interpreted is a choice and that the applicant's choice to maintain is sufficient to meet these criteria. Is that correct?
Correct.
Correct.
Very good. Thank you. Okay. On to our sixth issue area here. We have deals with whether the hearings officer's decision incorrectly found that the specific criterion in B1 and 2 and B5B are met or satisfied, and these deal with essentially a series of plans, technical plans, construction documents. The hearings officer found that all three of these criteria had been met by the applicant's burden of proof. And really this one is just the question before the board is whether the board finds that the materials in record are sufficient to satisfy those three criteria in terms of the information and materials that have been submitted there. If the board does find that the, and I do see Dave Doyle here. I don't know if you had a comment there.
I don't. I'm just jumping off a different Zoom and into this one.
Oh, okay. Very, very good to see you, Dave. Yeah, so I'll just continue. Essentially, it's just a question of whether the board finds these specific criteria to be met by the applicant's burden of proof. If the board finds that yes, this is sufficient and has been met by the burden of proof, then the board can adopt the hearings officer's findings that these are met or satisfied. If the board finds that no, there's not sufficient information in record, they can further deny the application on these grounds.
And one of the wrinkles with this is that the tail race was constructed prior to land use approval.
Exactly. That has some interface with these technical plans, certainly. I was going to offer this exactly how you're reading that code section there related to code violations. That does, I think for the purposes of our deliberations today, that probably more directly aligns with our next issue area, number 7. And so I'm happy to discuss it however you want, but I will go into a bit more detail on the next issue area. I just wanted to set the table with exactly like you're saying. If you want me to go into it now, I'd be happy to, Commissioner Chang.
Let's hold the tail race till the next time. Okay.
Okay. Yeah, and so again, just the question is whether B1, B2, and B5B are sufficiently met through the applicant's burden of proof.
Yeah, I support the hearings officer findings.
Assuming we can cure the tail race issue, then I would support the hearings officer's findings as well. That these criteria have been met.
Very good. Okay. And exactly that dovetails very directly into our next issue area number 7, which deals with whether the hearings officer's decision incorrectly found that the criteria in B5, specifically subsections F and G, can be met through conditions of approval. The hearings officer found that both F and G can both be met by these conditions of approval, the conditions drafted in the hearings officer's decision. And essentially the context for this one is that the tail race portion of the hydro facility has been constructed prior to land use approval. And the position of Land Watch is that because construction has begun, that the specific language in subsection G right there prevents this from being approved because a declaration, as mentioned in those criterion, has not been put in place before the construction has occurred. Exactly how Commissioner Chang was talking, even though, so that initially the first question we'll talk about here is whether the board finds that tail race construction to be a code violation. Even if the board does find it to be a code violation, exactly how Commissioner Chang said in our own Title 22 language, there is a possibility to cure, so to speak, this violation if all other applicable criteria are met. And so really before the board, as the first question is whether the tail race constitutes a code violation and whether it fouls that G language, sub G language in that a declaration is needed before construction.
So answering the question about if it's a violation, I guess I didn't quite prepare for that one today. So maybe we just need to dissect that a little bit more. And
Yeah. I mean,
would we be, defining a violation right here? I guess, I hadn't thought through this one.
Oh, because there's some weight to that particular word. I mean, what I will say is that we have codes and land use planning processes for a reason, and I would hope that anyone out there in Deschutes County who wants to develop something or build something takes those processes very seriously. And I am disappointed that this construction activity went forward before land use approval was secured. And I hope that others out there don't get the message that you can just act first and ask for forgiveness later, as opposed to going through the right steps and being sure to make your intentions clear and make sure what you're doing is okay by your neighbors. That's why codes exist, is to make sure that you're not having an impact on the people on the land around you. So that said, this particular project and the overall system-wide improvements that the Three Sisters Irrigation District has been pursuing for a number of years, I'm at the high level, I'm very supportive of. So if there is a need to cure a code violation, then I would support doing that.
When I would come to that same conclusion, is to say that's the logic I was going on. But if we're determining if there was a code violation today, we need to maybe tear that apart a little bit more before we make that decision. So Tara, can you help me with that? I guess I didn't get to this. Sure. On this topic, I didn't get that level.
No worries at all. I think a good way, maybe a different way to frame this particular issue area is it's kind of the top portion of that comment section there, is that if you can even generally find that F and G could be met through conditions of approval, that'll give us a very significant amount of direction on how to treat this particular issue area. Again, the hearings officer found that both could be met. It wasn't a fatal flaw necessarily that this feature was in place and that these declarations could be established through conditions of approval. That is in the decision. And what it sounds like is that it maybe isn't necessary to really categorize this as a violation or not. It might be more substantive to make a determination on whether F and G could be met through conditions of approval.
Yeah, and I do support that. So. I mean, we see different activities around the county for development, and as I said, for this development activity taking place before this, I'd have to research it more, but it can be cured, that's for sure.
So with that in mind, I would say that F and G can be satisfied with a condition of approval.
And Commissioner DeBone, would you agree with just that both could be satisfied?
Oh, yes.
It sounded like that's
condition.
more or less what you were saying.
Yep.
Okay, very good.
Yeah. So we're not going to go any farther with the definition of a violation. See, that was the one thing I knew is not prepared for at this point. But that's fine.
Sure. No, I appreciate the direction you've given me on that issue area, and I think that'll clarify a lot of information just as is. So moving on to our 8th issue area, thank you very much for the stamina and all the patience for this process.
Yeah, 35 minutes or so, 30 minutes.
Yeah, absolutely. So this 8th issue area.
Can I interrupt real fast, Commissioner?
Certainly.
This is Adam Smith, Assistant Legal Counsel. Just on the last issue, I just want to clarify and help perhaps with the language. What I'm hearing from the commissioners is that it's not necessary to even determine if it was a violation, because even if it was a violation, it could be cured with the granting of the permit. Is that a sufficient summary of both of your position on that issue?
Well, I would say yes. Knowing that there may be something in the record that I could go research more to come up with a more direction on that, but we're not going there today.
Yeah, and I understand. I mean, there's of course been. This is a relatively new provision, as the board is aware, in our code. It's been raised in numerous past circumstances. The board in the past has noted that sometimes there's not evidence in the record to actually determine if a violation has occurred. Sometimes there is. What I'm hearing from, as I stated, to restate from the commissioners, is it's unnecessary to even do that analysis in this case and to formally declare that there was or was not a violation, because even if there was a violation, it would be, it doesn't preclude the project from going forward pursuant to the land use permit being granted, right? So taking a sidestep and going through what's in essence a code enforcement proceeding before the board is an unnecessary exercise.
That sounds like a good.
Okay.
We're both nodding yes, so I'll say yes. Yeah.
I see that.
Yeah.
All right. Thank you, commissioners.
But again, I mean, I do want to emphasize again that people, we don't want to give anyone the impression that it's okay to just go do stuff and ask for forgiveness later. It really is important for people to follow land use planning procedures and to try to get their land use approval before they move forward with construction of things.
And we will, of course, the board will have an opportunity, of course, to review the final decision and to approve that final decision. This case is unique when compared to other past circumstances when the board has interpreted the provision in Deschutes County Code because of the language about needing to submit the declaration prior to beginning construction. But what I'm hearing from the board is that the provision on not issuing land use permits when there's an existing code enforcement situation on a property, one of the exceptions to that rule is unless the permit cures that code enforcement situation. And what I'm hearing the board state is in interpreting these two provisions, you're applying that general rule to this more unique provision. And again, we will write all of this out. It's a bit of a complicated analysis, but the board will, of course, see that interpretation and that step-by-step process in the proffered final decision.
Yep.
Thank you.
Written format.
Yeah. Thank you, commissioners.
Thank you.
Thanks very much, Adam. Appreciate it. And if there's no more comments on the 7th issue area and violation of the tail rates or anything in that sense, I'll move to the 8th issue area. And hearing no other notes, so the 8th issue area deals with the original legislative intent behind the county's allowance for hydro facilities as conditional uses, and whether that intent requires compliance with every criterion in both subsections A and B of our hydroelectric specific conditional use criteria. The hearings officer didn't make any specific findings related to the legislative history or intent, but the hearings officer in numerous places throughout subsections A and B found that various criteria were not applicable. And so with that information, this one's pretty broad, but the board has to determine whether that legislative intent as reflected in the record in the ordinance and document that are provided in record, whether this legislative intent requires a line-by-line compliance with every criterion, or whether and if yes, then the board can find that they can deny this application for lack of providing any kind of information with any of the criteria that have been deemed not applicable by the hearings officer. And conversely, if the board finds that no, not every criterion needs to be met specifically and some can be not applicable, then the board can uphold the hearings officer's decision and even supplement those findings further with any or all of the applicant's information from their legal arguments. But ultimately the question is whether all criteria need to be met or whether some can be not applicable.
So I think you just concluded it just now by saying, do all need to be met or some not applicable? I think, that's the big picture here. And this fits right back into the concept and the statement I made earlier about, this is that second facility down irrigation canal and not the natural flow of the river. So it is just a little disconnect in probably what was going on in 86 and what the reality is of this application. So I definitely can conclude that, some not applicable is a place to start here, and then go from there.
Very good. And so just to confirm, Commissioner DeBone, it sounds as though you're agreeing with the hearings officer in that some criteria can be not applicable. It's not necessary to meet every one of these criteria.
Correct. Yeah, having it all written out gives you opportunity to review each and every item that was mentioned in here too. So that's, that's the concept. Is it all required, or after reviewing this list and what we're applying for, what do we need to respond to?
I would agree with the hearing officer's interpretation as well, that the applicant doesn't need to respond to all of these, just some of them.
For the applicable ones, certainly. Okay, I will take note of that. And if are there any other comments or questions on this 8th issue area?
Yeah, again, it goes back to these questions about, back 30, 40 years ago, the kinds of hydro projects that they were envisioning, that they were trying to build policy around, are different than the ones that we're dealing with today.
Well, and then with the record as it is, so the written record, so I'm just thinking of Central Oregon Land Watch kind of said, well, we want it all, but if it's not going to be all, we still have some issues here. So I'm just thinking, let's see it in writing, if there's something substantive that we need to respond to here. But I support the fact that it could be a subset of these items.
Sure. Very good, commissioners. And with that, I'll move to the 9th issue area if we feel good about the 8th. This 9th, and again, we have two of the easier ones here at the end. We've made it through the harder stuff, so congratulations. The 9th issue area deals with whether the subject application meets the dimensional standards of the county's floodplain zone. This is very similar to the 2nd issue area. There's just a different zone and a different dimensional standard. In this case, it's an 80-acre minimum for this particular property. However, so the hearings officer actually didn't make findings for this dimensional standard. There's no analysis or information related to it. However, Landwatch is putting forward that because this property does not contain 80 acres of floodplain, it doesn't meet this dimensional standard and should be further denied. Staff's going to bring up the same point that from our own exceptions chapter, that these parcels that are under minimum size are still allowed to be occupied by allowable uses. And so really the question again before the board, similar to issue area 2, is whether this property needs to have at least 80 acres of floodplain in order to comply with that standard. If yes, then the board can adopt Landwatch's findings and deny this application for this additional reason. And if no, then the board can adopt applicant and or staff's position and move to an approval.
Well, and I think floodplain should be floodplain for the fact that, you know, there's maybe different soil types and there's, you know, water at an elevation. So this is kind of a logic exercise in trying to reverse engineer the fact that there needs to be a minimum size of floodplain. So, yeah, I would come to the conclusion that, yeah, whichever they, you know, the floodplain does not need to be 80 acres.
Yeah, I mean, again, we have this exception allowance that we have, you know, made historic use of. So, you know, with that, I don't think that the property must be at least 80 acres in size.
Very good. Thank you, commissioners. And this is our 10th and final issue area here. And this is a very general, it's an overarching criterion from our site plan code that has, essentially it's saying that if all other aspects have been met, all other applicable criteria, then this criteria can be met. So what I've heard, and correct me if I'm wrong, is that the commission has upheld many of the hearings officer's findings of being satisfactory or met, and then also upheld many of the non-applicable findings from the hearings officer. And by default, what I'm hearing is that everything else has been approved up to this criterion. And so by default, this would also be approved. But please correct me if I've misinterpreted any of your previous comments.
But I would agree from my point of view that the package is approvable. So that means we're over, you know, if the two of us agree, we're overturning a hearings officer decision. Yeah. I guess I'm losing track of DCC 18.1.24 or 124. What's the question in there, or what's the concept again?
Really, it's a catch-all criterion that just says its specific language is right there in the second column, but it's basically saying that if each zone's requirements have been met, then this particular subsection 18.124.060I can also now be met. Basically, it was a default finding by the hearings officer that this could not be found to be met because of his findings of denial for both the OAR and the MUA 10 reason. It's more of just an automatic result of whether the whole application has been approved or not. In this instance, it hadn't been, and so the hearings officer denied it for this third reason. And it sounds like with the board's direction and deliberation, we are moving towards an approval, and by default, this would likely be approved and met as well.
Yeah, so this is more of a default, not an analysis.
Yeah.
Right. Yeah, so it sounds like, yeah, this was there in case maybe we didn't reach an approval on any of the previous mentioned issue areas. This one would not have been able to be met. So with that, those are the 10 issue areas. And if you have any further questions or comments of me, I'd be happy to answer any of those.
Any comments?
Yeah, I mean, if this is the appropriate time, I want to go back to that idea of reviewing our existing code for hydroelectric facilities. I think that so with this hearing, we have been dealing with a very specific in-pipe hydro project. And even though I think we're giving green lights and you know support for this specific project, I think it is reasonable to ask questions about piping projects and hydropower projects in those pipes overall, because piping projects are, you know, they can be a costly way to get to water conservation. And if they're not implemented within system-wide improvements, where there's a lot of on-farm efficiency work and lateral piping work being done, then it's quite possible that you can implement a piping project, but not achieve as much efficiency and conservation benefit as could be possible. And that's not the case with this TSID project. I've been tracking, the work within the Three Sisters Irrigation District for a while, and I do believe that this is a case where there is a comprehensive, system-wide modernization and conservation effort being undertaken, which will provide some real benefits to Waichus Creek. But that doesn't necessarily mean that any in-pipe hydro project is going to provide similar benefits or be situated within a project that provides similar benefits. The Deschutes County Code wasn't written envisioning this kind of a project. It was written at a time where hydro projects looked like a dam and an impoundment, in an inundated area, and a turbine inside a dam, or something like the siphon project. And so I really think there would be some value in reviewing our existing code.
Well, and that's what we put a work plan together for in our Community Development Department and the Planning Commission, and they sure help us out with that. Yeah. So, just to acknowledge, the hearings officer decision will be overturned to make this from a denial to an approval. I want to thank both parties and all parties for the written, the public hearing and the written information. Our written decision is to follow. So, as I say, the intention of this deliberation is to approve, and the written decision will follow.
Commissioners, Adam Smith, Assistant Legal Counsel. Just for Commissioner Chang, as this is his first land use project, I thought I would just walk through that process real fast, if I may.
Thank you. Yes, please.
So, is our standard process? We invite the prevailing party to provide a draft decision if they wish. They have no obligation to do so, but I certainly think it's usually in their interest to do so. We coordinate a time frame with them on that. As the board is well aware, we do have a shot clock on this issue that's rapidly approaching. So after we receive that draft decision from the prevailing party, we impose a loose, sometimes firm firewall, so to speak, because it's not really a negotiation anymore with the prevailing party on what that final decision is. Instead, we get that draft, and then staff, trying to honor the intent and the language, reviews that draft decision pretty carefully to ensure that, in our professional opinions, it's lines up with the board's deliberations. Sometimes, as I'm sure, and I'm not saying at all that the applicant would do so in this case, but as the board can, I'm sure, speculate, sometimes applicants or the prevailing party can go a few steps beyond a board deliberation and their advocacy for a certain outcome in the decision. And so staff goes through that decision pretty carefully, redlines anything as necessary, and then staff presents that new version, the staff proffered draft decision, to the county commissioners, and then the county commissioners, of course, have the opportunity to make that decision their own, and sometimes a series of meetings, sometimes in just a single meeting, but it's really then a conversation between staff and the board to ensure that it captures your intent, with then at the end of that process, the board voting, in this case, to approve the project pursuant to that final written decision. And Tarek, I'm sure will immediately contact the applicant and work through that schedule. This will be a complicated one, and staff will certainly need a little bit of time to go through that decision, as will the board. There's numerous different issues, and some of those issues are quite layered. And so we'll work on that schedule with the applicant, honoring the existing deadline to issue a final decision and get this final matter back in front of the board here in just a couple of weeks.
Great.
Thanks
And
for that
I
rundown.
use kind of some very specific words saying the intention is to, overturn or make a decision. Because I've done this before where we have a full-on deliberation, you kind of break down each piece and make a decision. And then you're like, okay, we're done for the day. And then I've had the media call and say, now, was that an approval or a denial? So it's just kind of good to bring it home here in the end, so. Great. Well, thank you for your support.
It's the board's, discretion. I mean, you don't have to wait for the final decision to vote. You can have a motion and approval now with a final decision drafted consistent with that motion and those deliberations, or you can wait and vote when you have the final decision. It's the board's discretion on that matter.
Well, doing that procedure really doesn't move anything forward until there's a written decision anyways. Is that correct?
It doesn't do anything but provide the parties some certainty.
Yeah.
I would still like to see the written decision before we.
Yeah. Yep. So
before we fully sign off.
Noted.
Okay. So that was our last item for the day. Is there anything else? Any other items to come up? Seeing none, this is our second meeting this week where we're out in a timely fashion. With that, meeting adjourned.